very tricky, very politicized, very emotional issue that has big impacts. And so we try to do what we can to try to help give local communities guidance in that area. A newer part for us, as I mentioned, is prevention. And this is new in the sense of USICH looking way upstream of how do we stop homelessness before it starts, and not just looking at homelessness from the moment of crisis, like someone's just about to get evicted, although that is certainly important. And during the CARES Act and during the ARPA funds during COVID, the amount of funding that came from Treasury and other federal agencies for rental health assistance, we know, we have data now to show how much that prevented a huge rise of homelessness in the country. But what happens way upstream? What about the foster care system? We know who people are who are within the system. In a given year, almost 20,000 foster youth age out of care, and between a third and almost to a half of them exit foster care and experience homelessness by the age of 26. That is unacceptable. That is unacceptable. We know who they are. We know they're in a system. How can we not look upstream in prevention and figure out what is it going to take to be them successful into their young adulthood? In veteran homelessness, 6.9% of the adults experiencing homelessness are veterans. And veteran women are more than twice as likely as non-veteran women to experience homelessness. We know who the veterans are. They are part of the VA. And we've seen great success with veteran homelessness going down. Since 2010, veteran homelessness nationwide has gone down more than half. Why? We got the housing and the services as an ongoing piece that is sustainable in terms of the amount. Still some work to be done, right? Still some ways that we need to streamline and get things done better and to connect with people. But we show that is good data to show that housing and services together reduces homelessness. I wanted to touch base on one of the other initiatives through the federal strategic plan, and you might have seen some news yesterday and today in Denver, but it also applies here in California, that has to do again with addressing unsheltered homelessness. And this is an initiative we call All Inside. So we have All In, which is the federal strategic plan, and then we have All Inside. California, I know, has a phrase, California for All. And then Los Angeles is one of the communities that's part of All Inside. Mayor Bass's thing is Inside Safe. So I just say Californians for All Inside Safe, and I think we've got it down. That's for the part for LA. But on May 18th, we launched this initiative. It's a place-based approach that includes the state of California. The other communities are LA in particular, Dallas, Seattle, Chicago, the Phoenix metro area, and then as of yesterday, Denver. And the idea behind here is to create an innovative and tailored support to participating communities through 2024, the end of 2024, where we embed a federal employee in each of these communities to really focus on the wonkiness of policy that leads to gridlock, and to get rid of that gridlock, that bureaucracy busting kind of work. Deploy teams and have people throughout our federal agencies dedicate time to focus on what is it going to take to make it easier for people like you across the room doing the work on the ground to get people from homelessness and into housing with supportive services, to get it faster, to get it less expensive, to make sure that if you're abiding by one policy over here, you're not violating another policy over there, to really streamline those kind of pieces. Trying to also figure out how we can convene philanthropy, private sector, other communities to identify these opportunities. So California is it's the only state in it, and because we wanted to acknowledge and recognize the amount of state investment that's going on in communities throughout California, and what can we do to then make sure that the state policies and federal policies together are working as best as they can. So we're in the state of California, the way we're focusing on it is through a people-based approach, looking at veterans, looking at youth, which are aged 18 to 24, I believe, and then older adults, which is 50 and plus. I'm over 50, and so it's like, okay, but I guess I'm an older adult. But older adults, veterans, and youth aged 18 to 24. So the scope of the project will be to identify ways to reduce federal barriers that might be currently preventing them from accessing housing or services. So for an example, you have some, Home Key was an example that came up where the governor and the state legislator put out a significant amount of money for communities to renovate or purchase a motel hotel, convert to permanent housing, and they waived CEQA requirement, it was CEQA review for this, the California Environmental Quality Act. Well, some of these same projects that communities were looking at, because of the funding stream related to it with the federal funding, then sparked NEPA, the national, so it's like, well, you fixed one, but what about this over here? So what are the things that we can do to streamline those areas? So some questions I'll leave you here with that would be very helpful in getting us to the bottom of this and really figuring out what we can do. It's wonky, I know it, but we know when we get this kind of really detailed kind of work done, we can really make things work better for everyone. So think about those three populations in California that we're focusing on. And are there any federal barriers that you can identify that hinder access to housing and or services? I know one answer is we need more money. I wish I could wave a wand and give that to you, but that's not one of the, but like look at the policy issue, look at the structure and moving forward. For these federal barriers identified, do you have any examples from your community on how those federal barriers could be reduced? The more specific examples we can bring to our federal partners, the better communication and kind of creativity we can come around to figure out how to make this work better. Are there any federal waivers that have been implemented in your community for these three populations that have helped improve services? What happened during COVID that we were able to do that have now been closed off now that the national emergency declaration's been is over? So what could be implemented on our end? So things like that, and please do reach out to me to see what is possible. And then my job is to connect with our federal team leads who are covering California. There's also one in Los Angeles, so focusing with both of them and helping move these pieces together. Cody's here as well. You're going to hear him a little later on the panel, and he's been very much involved in this. So again, I just want to, come back to that political will, the coordination, the collaboration, the dignity of the work, and to work with dignity and respect all of those who are involved in this work, and that persistence. And I'll end with one more story that happened in Santa Barbara. This was related to our police department has a street outreach component to it, restorative policing component. And they met with this woman who in 2017, the happy story at the end, and in 2017, she reunited with her 3 children after they didn't know where she was for more than 10 years. What happened was she went missing from Valencia. This was back in 2006. And her son reported her disappearance to the LA County Sheriff back in 2006. It was entered in a statewide database. Detectives were trying to follow leads. They got nowhere. Little did we know in Santa Barbara, this person was in Santa Barbara. She could not remember her name. She was 68 years old. She had severe memory loss. She called herself Mary. She didn't know her social security number. She did remember she had 3 children. She slept outside the library pretty often. She worked with various organizations, Doctors Without Walls, our restorative policing program, maybe went to the shelter once in a while. And in those times, that engagement, trying to figure out who, it's like, is it Mary? Is it someone else? But she would say, I don't remember my name. She was at the PATH, the local shelter, for almost a year, consistently connecting with providers. And one day she was able to tell someone, my name is Gabrielle. And she gave her full name. So the Santa Barbara Police Department went to the missing person database, and lo and behold, there she is. Connected with her family, she went back to Colorado. She met her grandchildren for the first time. And someone from the department said, this is a story about an entire community keeping this woman safe, taking care of her, not giving up hope. And at the end, we have a miracle. And that's the work that you do every day. I want to thank you for that. And I'll end by another person during our federal strategic plan, and what this person said is from Fairbanks, Alaska. And it's about really, in all the work that you do, to please take the time to take care of yourself on how important self-care is for you and your team. And this person said, direct service providers are soul crushingly tired. Please reach out to them. Please listen to them. They need to know that people in power support them and want to improve their broken systems that they're working in. So thank you for that, for the work that you do each and every day. I'll be here all day, be happy to talk with you, and I hope this is the beginning of many conversations into the future. Thank you so much.
Another round of applause for Helene, our keynote. That was wonderful. Thank you. Please note that at this time, we will be starting our first breakout session. Our conversation will start back up at 10:45 p.m., where in the gallery room, we will be hosting a conversation on coordinated entry, moderated by Elaine DeColony. And in the Salinas room, where we are right now, we will be hosting a conversation on the federal and state strategies and impact on local decision makers. See you back at 10:45, everybody. Just a reminder, folks, we're going to start back up in 5 minutes. Selena's room will have a conversation around federal, state, and local plans. And to my right is the gallery room where we will have a conversation around coordinated entry. Thank you, everybody. I'm excited to start back up in 5 minutes.
If everyone would please take their seats, we'll get started. So, welcome everyone to the first panel of our learning session number 1. Want to make sure that everyone's in the right room. This will be federal and state strategies and the impact on local decision making. So thank you, everyone. I'm Kurt Shockey. I'm the executive director of the Veterans Transition Center, a local nonprofit that serves veterans and their families with housing and all the wraparound services. And I'm also the president of the local coalition. So we're delighted to have you here. We're delighted to kick off our first panel with a very distinguished group. So the moderator for the panel will be Roxanne Wilson, who is the former executive director and is currently the County of Monterey Homeless Services Director. You've met Helene Schneider, so Helene, if you would please come up, the Senior Regional Advisor at the U.S. Interagency Council on Homelessness. Cody Ziegler, the Director of Statewide Policy at the California Interagency Council on Homelessness. Justin Garrett, the Senior Legislative Advocate for the California State Association of Counties. And then, of course, Genevieve Lucas Conwell, who is the ED for the next 16 hours or so. So, Roxanne, over to you.
Thank you so much, Kurt. Good morning, everyone. What an incredible and rare opportunity we have today here in Monterey County. I don't think for the 10 years that I've been in homelessness have I ever seen federal, state, a representation of all the counties in the state of California and our local continuum of care on the same stage, talking about how we're going to do this together and how we're going to do it independently. So, welcome. As I had mentioned, we have, you guys have heard that we have Helene Schneider from United States Interagency Council on Homelessness. So we're gonna start with you. Each one of your entities has released or updated a plan to address homelessness within the past 2 to 3 years. I'd like to start by giving the audience a general understanding of the distinctions between your plans. So give us a quick elevator speech, 3 minutes. Yeah.
Well, I think I can give most of my 3 minutes to everyone else because you just heard about the federal strategic plan, and I'll just mention here how important it is about the plan all in to leverage and connect with the state and county and local plans. And so that's part of the guidance we also can give as your senior regional advisor into local governments. But that huge piece of coordination and collaboration is key as part of the federal strategic plan. But you just heard me for half an hour on that one, so I'll turn it over to Cody.
Thank you. I will take some of your 3 minutes.
There you go.
And I already asked Roxanne to cut me off if I'm going too long. But yeah, good to see everyone. Thanks so much for having us here. I'm Cody Ziegler. I work for the California Interagency Council on Homelessness. So I actually was going to introduce what we do, but I'm just going to say ditto to what Helene said. We are modeled after the U.S. Interagency Council on Homelessness. We have 18 directors or secretaries of state departments or agencies on our council and 2 community member leaders that make up the council. And our goal, right, is to coordinate the work at the state level on homelessness, on preventing and ending homelessness. So that work is really guided by our action plan, which I did not come prepared, but one of my staff came prepared and brought this so that I could show it off to the group. But we have our action plan for preventing and ending homelessness, which is really the document that guides the state's work and tries to ensure that we are all on the same page as we do this very complicated, very hard work of preventing and ending homelessness. The purpose of our plan is to set direction, right, for the state and say this is our vision, this is our goal, but it is also to document the work that the state is doing. And I'll get into that a little bit. But to really say, what is the state doing? You know, well, how are we holding ourselves accountable? What are the performance measures we're looking towards, right? And having sort of a centralized way of showing what we're doing and understanding where the state is headed. So that's what the action plan is. It has a vision of making homelessness rare, brief, and a one-time experience. It sets out goals for us for increased state leadership, meaningful coordination at the state level, and as well as collaborative partnerships with our local partners like you all here today. It has 5 action areas around strengthening our systems, addressing unsheltered homelessness, increasing access to housing-focused interim housing and shelter, increasing access to permanent housing, and then of course prevention like Helene talked about before. It covers our work from so this plan was adopted in March 2021. So if you think all the way back to March 2021, we were very like deep pandemic, right? No one could think 2 days ahead, let alone 2 years ahead, right? So we were creating this plan, asking people, what are you doing in the next 5 years to prevent and end homelessness? And they were like, what are we doing tomorrow to prevent and end homelessness? Like, that's what we're thinking about. And so the plan has evolved over time, right? Every year we update it. Every year we keep adding activities that the state is working on as our work evolves. And at this moment, I think it encompasses over 170 different projects that are going on at the state level across our 18 council member departments and agencies. So it's pretty thorough. It's a thick document, but it is really useful, I think, as I said before, it's sort of trying to document for you all and for us at the state, right? Like, what is the state doing, and how can we be held accountable to that, and how can we also make that, get everyone in alignment? So the last thing I will say before passing it on is that we are the end of our plan. The plan officially ends at the end of this fiscal year, so in June 2024, and we are going through the process. We're just starting the process of creating a totally new plan. So we're not just updating it. We're looking at all the aspects of the plan. We're looking at all the activities and saying what's working, what's not working. So we will be engaging in public input discussions around all that. We will be reaching out. Hopefully you will see my name and email and be like, stop asking me what I think about this plan, because we hope to get a lot of engagement on that process. So thank you all again, and I will pass it on.
Thank you, Justin.
Good morning, everyone. So CSAC is the representative for counties at the state level and at the federal level for policy and advocacy. So we represent all 58 counties. We are the voice for county boards of supervisors, and we recognize fully the crisis that homelessness is around the state. And so we really took on the initiative in a bigger way than we have on other policy issues over the past year. So the end result of our work is the at-home plan, which I'll talk through what that is. But it came from the counties up. So we had several county work groups, both a board of supervisors working group, and then another working group with all the key departmental directors. So social services, behavioral health, public guardian, sheriff, parole, homelessness coordinators, CAOs, all involved, all sharing what's going on in their county at the local level. We went through, an inventory of the programs and funding streams that are out there. We did a full county survey, just trying to understand everything that's needed to change, to transform, and so we can all collectively do better in our homelessness response. And so I want to thank Supervisor Alejo for his leadership, both in several roles during that review and input process. He really shared a lot of the great work that's happening here in Monterey and San Bernardino County, and so that's definitely reflected in the at-home plan. So it was released in March. It stands for Accountability, Transparency, Housing, Outreach, Mitigation, and Economic Opportunity. And so within each of those pillars is a series of policy recommendations that CSAC will plan to engage on and support in partnership to further our efforts on homelessness. So with accountability, this is really transforming the way, the collaboration, the accountability for the funding, just making sure it's used as effectively as possible. With transparency, this is about data, strengthening our data systems, both in terms of what's collected and how it's shared and utilized. With housing, this is, building more affordable housing, making sure there's more housing available for all the different high needs populations, older adults, those exiting foster youth, those with behavioral health conditions. With outreach is next. With outreach, this is about the encampment response, so reaching out, supporting the workforce, supporting those with lived experience, and just helping the services work better. With mitigation, this is really about prevention, so all the great county health and human services programs that are out there helping to prevent more individuals from becoming homeless. And then economic opportunity is about helping those who are ready for self-sufficiency, providing job training and opportunities, and then strengthening SSI and SSP benefits for those who may not be able to enter the workforce. So with At Home, we're very excited about it. We've done a lot of great work over this past year, which I'll talk more about in future questions, but this is the county and the CSAC plan to really transform the homelessness response in California.
Thank you so much, Justin. And now I'm going to pass it on to Genevieve. The local plan means a lot to me, clearly, but I definitely love the work that you guys have been doing. So can you also share what the local plan is all about?
Absolutely, I can. So one of the reasons why it means so much to Roxanne is because she led the effort for our Lead Me Home plan. So after the summit, our Lead Me Home plan, there's a parallel, right? Lead Me Home Summit, Lead Me Home Plan. That's the name of our COC. The Lead Me Home Plan is a 5-year plan to reduce homelessness by 50% in our region by 2026. The plan was started in terms of coordination with our different stakeholders in 2020 and started in 2021. The stakeholders that were involved in that conversation was our leadership council, that's our continuum of care board, City of Salinas, which is the emergency solutions grants recipients, as well as folks with lived experience. We want to make sure that anytime we're creating a strategic plan, it's a document for the community by the community. That's really, really important to us. So our plan has 50 plus voices involved in it, as well as comprehensive system performance analysis, such as a predictive modeling system in there. We have included a point in time count. We really made sure it was data driven in our plan. In 2020, we decided we wanted to really focus on 3 different areas in our Lead Me Home plan. The first focus is to increase stakeholder participation. And actually, one of our initiatives is to host this space right here, right now, making sure that all stakeholders are part of the conversation. Homelessness touches so many different sectors, such as hospitals, judicial system, education, services providers, that we need to be in conversation, actively talking to each other. What does that look like locally? So not only setting up the Lead Me Home plan or Lead Me Home Summit, but also making sure we have committees in place where we're addressing spaces that need to be talking to each other. Youth systems providers, for example. If we want to create a system for youth to survive or to thrive, if they're experiencing homelessness, we need to make sure that each youth system providers is talking to each other. Outreach committee, who is boots on the ground? Where are you guys going? Let's talk to each other. Let's work with each other. We're not going to get anywhere if we're not working together. And our lived experience councils. We have both a Youth for Action board as well as a lived experience advisory directive. So we're really making sure that we have active participation from everyone in our community where homelessness is affecting that community. The second focus is improving our performance system. So that looks like how do we prioritize folks into housing first? The conversation right next door to us is our coordinated entry system conversation. How do we look to see who we refer? And how do we determine vulnerability? Let's get into that real quick. So that's something that we're looking into this next year. And we're starting today. We're opening up the conversation today. Second is increasing services on the ground. So instead of having folks experiencing homelessness come to us, we want to make sure we're providing services to them, we're meeting them where they're at. So that looks like applying for funds such as the Encampment Resolution Fund. It looks like making sure that we are setting up those conversations with outreach and making sure that what are the gaps in services? For example, mobile showers, laundry. We shouldn't be expecting folks to be seeking those services. Certainly when folks don't know where they're gonna go to the restroom next. It's basic services we wanna make sure that they are able to meet so they're able to survive and thrive. How can we expect somebody to go to a job interview and try and get themselves off the streets when they don't know where they can shave or where they can get clean clothes? So we want to make sure that we're reducing as many barriers as possible for folks. That's a little bit of the spiel.
Thank you so much. What are some concrete examples of initiatives that your entities have rolled out since your plans have been adopted or released?
Great, thank you. I mentioned earlier the All Inside initiative. That's really been taking up a lot of our focus related to the unsheltered crisis that we're seeing. And again, that's happening throughout the state of California that we're working on in connecting state and federal policies, but also within the city of Los Angeles and coordinating those activities there. And then prevention, we're figuring out what the initiative is. We don't really have an initiative yet, but figuring out what partnerships and ways that we can focus on an upstream prevention. And coming soon, some of you may have seen a request for information that we're putting together a research agenda out. So trying to have in one space all the different data, research reports that can help people use information and data to help them in their own initiatives and have to help with your decision making and have it be decision based. I'll mention one last thing. One of the things that we put out, one of the tools that we put out earlier this year on the website is a resource library related to climate change and disaster preparedness and recovery efforts as it relates to homelessness and housing instability. I want to acknowledge, as I was up here, I was up in Santa Cruz yesterday, and on my way up, I went over to the Watsonville Pajaro area, and to, trying to understand better, how can we better connect, for example, Army Corps of Engineers, FEMA, EPA, in areas where there are encampments in waterways. How does that relate to environmental impacts? How does that relate to, obviously, safety concerns amongst those living in the encampments? And then infrastructure issues too, especially in areas that are underserved, that may have not received the same kind of funding for capital improvements that as other areas in higher income areas have. So that has been a conversation and focus that we've been focusing on as it relates both to prevention and the encampment resolution process as well.
Thank you. Cody.
Great. So as I mentioned, our plan is really focused on like the state level coordination. So a lot of the initiatives that we are working on right now and that my team is focused on are really sort of the like high level background work to try and get us all on the same page, right? So I'll mention a few of those. We have these interagency working groups that are called for very explicitly in our plan. And two that I want to highlight are, one is on state funding and programs, right? It's staff from 13 different state departments and agencies that fund homelessness services or housing. And it is them getting together and saying, let's look at all of our grant programs. I mean, you all know this best, right? Let's look at all of our grant programs. Let's look at where they overlap. Let's look at where they don't overlap. Let's look at where we're asking for duplicative information or we're asking for conflicting information, and try to work at that level to streamline, to coordinate, right, as much as we legally can. So that's one group that we've convened and we're pushing forward through our plan. Another group is specifically focused on racial equity. So looking at the disparities of those served in the homelessness services system in California and saying who is not being well served here, right, and why is that? And so we've convened a group of both state staff as well as community members to come together and say, what's going on here? What are the best practices? What can we lift up? What do we want to share across the whole state? And what do we want state departments and agencies to know or to do about these issues, right? So this is the type of work, going on in our plan. Another initiative that we are pushing forward right now is that we have just launched our lived experience advisory board. So that's 11 individuals from across the state who are really meant to bring their experience and their knowledge into the policy making that's happening at the state level. This is, again, something that our action plan said was a key principle in practice, right? Was valuing the expertise of people who have experienced homelessness in the past. And so that is something we're taking really seriously, and we're starting this group to help advise our council and our as a whole, and also just like individual departments and agencies as well in their work. And the last thing I'll mention briefly is Helene mentioned Housing First earlier, and part of our plan is ensuring that we have effective implementation of Housing First at the state level and providing resources to people at the local level. I really love what you said around like, we haven't necessarily had the resources to actually implement it properly and be successful at that. And one of the goals at the state level is to say, let's make sure everyone at the state is on the same page about what the rules are around Housing First, the statutory languages, right? And then what value add, what can we provide as the state? What resources can we add so that people actually have the opportunity to implement Housing First in the way that is effective and is meaningful? And so those are three things hidden away in our 170 activities in the plan that we are focusing on heavily right now. So I'll stop there.
Thank you. I'm glad you guys are talking about Housing First, because I heard it once and I'll never forget. Housing First doesn't mean housing stupid. So we have to have the resources in order to do it well, but we've seen it done well and we've seen it be successful. So if it's not successful, that means that a lot of times that organization is just under-resourced and unprepared. But it does work. The numbers definitely don't lie. Thank you so much for bringing that up. Justin.
Well, with At Home being a series of policy recommendations that all work together, the initiatives that we engage on are really about, bills and budget items at the state and federal level. And so we certainly supported and engaged on a number throughout the full 6 pillars of At Home, but our real focus this year was the accountability pillar. We knew coming into 2023 with the governor's leadership and interest, as well as the legislature's leadership and interest in terms of transforming the state funding, ensuring more accountability, that there was a real prime opportunity for some positive accountability provisions within the state's homelessness funding. And so we were ready for that with our At Home plan. We built the At Home Coalition for Accountability, so more than 40 counties have adopted a board resolution in support of the At Home plan. I want to thank both Monterey and San Benito County for adopting that. And then we also had 70 plus overall organizations, community organizations, business organizations, other local government partners that were in support of the coalition as we pushed at the state level for some significant accountability changes. And we appreciate the openness of the governor and the legislature in terms of hearing the voice of counties and what accountability could look like with the HAP funding. And the things that we were advocating for were, required regional collaboration, defined roles and responsibilities for counties and cities, continued flexible funding, and then accountability provisions that, support the funded entities in achieving their goals and supporting their efforts. And so we were really pleased to see a lot of the things that were included in AB 129, which was the budget trailer bill that enacted, another round of $1 billion for the HAP program, as well as these accountability changes. We think it provides a great opportunity for everyone around the state to continue making significant progress in addressing the homelessness crisis. And so that was our big focus as our At Home initiative this year.
I want to take a pause because sometimes we speak in acronym alphabet soup. Raise your hand if you know what HAP is. Raise your hand if you don't know what HAP is. Okay, HHAP is the Homeless Housing Assistance and Prevention Program. It is a state funding source. It is not guaranteed, but so far the governor has had 5 rounds. Cal ICH is the entity that is responsible for rolling that out. Shout out to Cal ICH staff that's inside of this room right now. So with AB 129, there is a slew of changes on how the entities that can receive the funding are able to receive the funding. And like they were talking about, a lot of that is accountability. So even today, there's QR codes on all of your tables. Please take a snapshot and do that survey because that's a part of our AB 129 requirements. You like the way we squeeze that in? And later on today, this is a shameless plug. We're also doing another input session also to meet our AB 129 requirements. And this is a partnership with the Continuum of Care, the County of Monterey, and also the County of San Benito. And I'm going to get off of my soapbox now and get back to the conversation. And I'm sorry, Genevieve.
No worries. Hey, appreciate the plug. We got to hear the people out. Yes. So in terms of initiatives that we've done recently, so for each of our Lead Me Home, for each year that we've been in our Lead Me Home plan, we have a yearly action plan as well as a yearly progress report. We are midway through our plan, yay! And we're actually doing really good. So just real quick, we're doing really good in terms of reducing homelessness and getting to that 50%. So cross our fingers, we're going to do the point in time count. Anyways, getting sidetracked. So in terms of, we're on our year 3 action plan. We just released our year 2 progress report. It's up on our website if you want to check it out. But what we've done so far in our year 2 progress report is for our first focus, which is increasing stakeholder engagement. I've already started talking about it a little bit. We've held our first Lead Me Home Summit last year that was virtual. We started our Lived Experience Advisory Directive, which was amazing. And that was co-chaired by Timothy Heaven and co-chaired by Lavisha Franklin that are in the room right now. And you'll also plug, there'll also be in a panel at 12:30 for reflections with folks with lived experience. So making sure that folks that are actually have had the most important experience when we're talking about solutions are in the room. So what their responsibilities look like is being an advisor to our COC board, our Continuum of Care board, the Leadership Council. And what that looks like is that they're in the room when we're deciding who to fund for COC, for our Continuum of Care notice of funding opportunities, for our homeless housing assistance program, funding opportunities. They're there in the room to decide who gets funded, what kind of parameters are we looking at to make sure that there's impact that's happening, what goals are we asking service providers to meet, and measures what's important. And we're also hearing their side too, making sure that we get client input into how services providers are doing and how can we support service providers as well to excel, to make sure that we're connecting the two, service provider and clients. We also have our Youth for Action board. Our Youth for Action board has done a lot of work with this new HUD grant called the Youth Homeless Demonstration Program. The Youth for Action board has been really instrumental in actually kind of setting the pilot as to how do we include folks with lived experience into the conversation. So they've been able to create monitoring policies. How do we monitor our folks that are that we're funding? How else they've been really involved with Youth Homeless Demonstration Program, and we're really grateful for them to be part of the table to make sure that we can end youth homelessness in Monterey and San Benito County. We also, part of that has been to make sure that cities and counties adopt our plan. So far we have the City of Soledad and City of Monterey that have adopted it this year. In the first year, we had the City of Salinas, King City also adopt the plan. And in terms of counties, we had Monterey County adopt the plan in their first year, as well as County of San Benito. So we want to make sure that more cities are adopting the plan. We've done the work. We want to make sure that each city has a plan and a coordinated plan for how they can support their unhoused population in their cities. So that's our focus number one. Focus number two, improving performance systems. You've heard from Supervisor Alejo that we have built out our first youth coordinated entry system, a separate system where youth who have different questions in terms of assessments. It's been built by youth with lived experience. It's been built by youth with youth systems providers. We've created that system. We're also digging into our coordinated entry system. Who's missing, who's falling through the gaps? Let's make sure we're including everyone. Let's look at vulnerability. Let's make sure that folks get prioritized based off of that vulnerability we create a local system that works for us, for Monterey and San Benito County. So that's a little bit of strategy number two, which is the system improvement. And then focus number three, which is the making sure we have more services on the ground. We have looked at making sure we have an outreach committee, coordinated outreach, who is going where at what times, who has everybody's phone numbers. We also, like I mentioned before, we have the City of Salinas that applied for the Encampment Resolution Fund, the County of Monterey that applied for the Encampment Resolution Fund, making sure we're building transitional housing, permanent supportive housing, emergency shelters, that we have a diversity in services regionally. That's a little bit of our focus. So now we have North County, we have South County, we have Salinas, we have the Peninsula. Let's make sure that all of our regions at least have some services so that folks can access services. They don't have to travel far. It's close to them. So that's a little bit of what we're focusing on in this next year and what we've been able to do so far.
Thank you so much. Highlighting the service gaps, we have many, right? In Monterey County, you get to a point to where there is nothing for miles. But thank God for new leaders and all of the work that's already taking place behind closed doors. And I'm very excited that we have a lot of work to do, but we have a lot of people at the table from South County saying, we're in, what do we need to do? So thank you, everyone. The next question is, it's a loaded question. In your opinion, what are key challenges or obstacles that local stakeholders often face when attempting to address homelessness? And what advice or strategies do you have for overcoming these challenges? I'm going to sit back because we're going to be here a while.
I'll mention, yeah. Well, how much time? Right. I'll mention two, and I'll preface it by this is also why plans are so important to have, because the plan, as long as it's not putting dust on the paperwork, right? It's on the shelf, that it's implemented. You have a plan for the plan, the implementation piece to it, because leadership changes all the time, right? And up to those changes, sometimes there are very contentious elections that happen among some of your political leadership that may or may not have to do with the plan, but it has to do with the people that you have to interact with. And those outside issues may kind of creep in to actually trying to get some work done, right? And even if it's not the elected leadership within your own communities or agencies may also change. So how to keep that continuity going and keep the momentum happening in the face of those changes, figuring out what a succession plan could look like, having who are the staff involved or the key leaders involved in your plan that can be that kind of transition and that institutional memory moving forward. That is so, so important. And to have a document like a plan that had the community input and will and upfront piece, upfront to say that this is how we're moving forward, really then helps bring in new people in and training them to get acclimated to what the plan is, wherever it is in its stage of implementation. So that's it happens all the time everywhere. We shouldn't be surprised about it, but it happens like, oh, it's that so-and-so and that important seat's no longer there. What do we do? I mean, this happens everywhere all the time. The other one I think really challenging is what's become, unfortunately, the politicization and the rhetoric on the issue of homelessness and how to handle it. That it feels like a zero-sum game in some areas, or the vitriolic social media that happens that really weigh down not only on those doing the work, but gives a lot, puts up a lot of pressure. And with that, how I address it, I have a term that I like to call froth. Like, I like my cappuccino, right? Cappuccino has a lot of froth in it. It's kind of nice, but it's not much substance to it. It's airy, it's hot, it has a lot of bubbles. It has, it goes all over the place. That's there, and it's a part of what's going on, but you got to stick with the coffee. The coffee is what wakes you up in the morning. The coffee's what keeps you moving forward. And sometimes we pay too much attention to the froth and not to the coffee. So beware of froth.
Got it. We will hashtag that later. Cody.
Now I'm just thinking about froth. No, I agree with all of that. I think something that I was thinking about as it relates to the state is right, and the work that we're doing, hopefully in partnership with you all, is like everyone who works in this sector knows that we are fighting a battle against decades and decades of less support and funding than we need to make actually a change in the system that we want to see, right? And then, the pandemic happens and suddenly there is an influx in funding in many different ways. And I think something that we saw was that not only can we do the work when there is that funding, but also sometimes that funding is really hard to access when there's when there is funding even, it can be very difficult. And so something that we are thinking about as the state is the funding that we do have, right? Trying to make it more accessible and trying to make it easier to understand like what can be used where, make sure it is coordinated, like I mentioned before, across state agencies and departments, because we know that when things are complicated or duplicative or whatnot, what that means is that all of you are looking at this being like, why am I filling out this form again? Like, why are we collecting this data but in this separate form? So really what we're trying to do is hear from you all and hear that experience, and you are our end users in many ways, to use that terminology, and really understand how to improve the system at the state level so that you all can do your work with thinking about us as little as possible, hopefully. And one of the ways that we do that, just as an example, is we have what's called the Strategic Spending Guide that is on our website. It is literally a document designed for the folks in this room who are applying for funding or making decisions about state and federal funding. And it's a document that says, here's all the state and federal funding that exists. Like, here's the eligible uses for that funding. Here's where we think that you could utilize this funding over that funding, et cetera. And I will say, you all are getting a preview, we are about to release an updated version of that document in like a few weeks, which the wonks at Cal ICH are very excited about, and hopefully other folks are too. So that's just one thing that we know. And the other thing that we know is really a challenge that we are hoping to work on, and it's a core principle for us at Cal ICH, is lifting up best practices when it comes to the work around racial equity. We know that is something that all of you contend with, and in different ways, you all have different communities that you are serving. And we know that there's really good work happening. So how do we share what one city is doing with the rest of the state? How do we lift up what one county or one COC is doing with the rest of the state, and actually provide resources so that those things can be implemented across states. And we can actually not just provide a webinar and information, but really like provide resources and training where it's useful, because we know that information is great and y'all are busy using the resources that you have to the max capacity. So really trying to understand where we can add value there.
Thanks. Those funding crosswalks during the pandemic, clutch. Thank you so much. Justin.
All right. So the three big challenges that came up during our at-home plan development were really the lack of local collaboration and coordination, sort of the finger pointing, not having defined roles and responsibilities, particularly between counties and cities, and then the lack of ongoing funding. And so, not everywhere around the state is having this great local collaboration that exists here. There are some parts of the state where it is more difficult to get everyone together in the same room and to be coordinated and to be, moving forward together on what the plan is and how the funding should be used. And so now with, again, the new requirements in AB 129 and the next round of funding for the Homeless Housing Assistance and Prevention Program, there will be those opportunities where everyone will have to come together. So now that collaboration is going to be required. So we think this is greatly going to further those local partnership efforts. And then in order to receive any of that funding, which is obviously a huge, significant funding source for what can be done with homelessness response at the local level, you'll need to sign an MOU as a county or a city and a COC defining your roles and responsibilities. And so this will really help bring everyone to the table to say, hey, I'm committing to do this work. This is the responsibility of this city or this county. And now with that being a requirement, we don't think it'll help get rid of some of those finger pointing challenges that exist in different parts around the state. And the last one, while there is not yet an ongoing funding commitment for the HAP program, there is a significant amount of funding this year, and everything that's going to happen with the local plans, that's going to help make the case for additional funding. So either both in terms of like, here's, everyone coming together, community organizations, cities, here's all the work we want to do. But we can't, either do everything within the current plan because of we needing more funding, or, we need ongoing funding to make those long-term investments over a longer period of time. The amount of work that's going to come together for this plan should really be something that guides, a county and a COC's work over the coming years, not just for 1 year. And so we're really excited about the possibility of what exists with this next round, and we think it'll help overcome some of those challenges.
Thank you. Genevieve, you get to see it firsthand. You get to hear it firsthand.
Yeah. That is such a loaded question, Roxanne. But no, it's a wonderful question in the sense that, so our vision at the coalition is for us to make sure that homelessness is rare and brief and that everyone is met with dignity at every step of the way. So the key word there is that it's rare and brief. We acknowledge that there's also things that we can do. We're not going to stop from folks losing their housing. So when they do lose their housing, we can make sure that they have the resources available to them so that they are met with dignity and respect every step of the way once they do lose their housing. So right now, in a sense, there's a lot of folks that, first challenge is making sure that we have a continuity in services. We're continuously building affordable housing, continuously building permanent supportive housing, transitional housing, emergency shelters. It doesn't end. Right now, I'd say one of the biggest things is we don't have enough housing, right? We hear it every day. We just don't. So emergency shelters is not really emergency shelter. It's really, folks stay there for a really long time. It's not for 1 night or 2 nights. It can be for months. Transitional housing, we're seeing folks that really need more than just 2 years. Same with rapid rehousing. And same permanent supportive housing, we always echo here is the best solution. We want to make sure that those that are chronically homeless get placed into housing first, right? Making sure that we get them into permanent supportive housing. So there's a bottleneck. We need to name that. We need to create a continuity in services, making sure that we're always building, always making sure that we're growing with the population, right? That's just kind of the reality. And so that, I would say, is one challenge that we're working on, right? We're the system. So we're making sure that we have a system that can work for the people, for our community. The second one, I would say, my roots are in case management. And I would say case management, making sure that case managers have the resources necessary to be successful to support folks experiencing homelessness. And the reality of it is there's not enough funding for agencies and for even us to be able to support staff at the level that they, number one, deserve, as well as for their own continuity and for their own well-being. So I would say that that's something also a challenge that we see is we want to make sure that we have strong staff that are here for a long time that can support and do the work. There's a high burnout. National Alliance to End Homelessness actually did a wonderful report and survey around case managers and service providers. And so it's really digging in, seeing how we can create and support them with resources that we have access to. But it's kind of a trickle down effect. There's only so much money that we receive in homelessness. So I'll stop there for those two challenges.
So thank you so much for calling it out as far as what people, there we go, who are doing the direct services are experiencing. It is hard work. It is so frustrating when you have someone who finally said yes and there's nowhere to send them. So keep doing the work, right? Keep trying, keep building. Thank you all for really calling that out because it's very important for everyone to hear. There are common themes in all of your plans, like equity, collaboration, accountability. If there is one thing you would like for the audience to take away from your plan, what would that be and why?
Yeah, there's a lot there. I'll start with our federal strategic plan, the first pillar with leading with equity. You got to start there. And in the federal strategic plan, strategy number 2, so I'll read it out. It's to promote inclusive decision-making and authentic collaboration. We hear the phrase of a lot, nothing about us without us, right? And having that be a key component in everything that you do in terms of strategy thinking, implementation, looking at policies, figuring out what could work, what can't work. The part of the strategy goes into more detail. It says, I'll just read it. It's right from the plan document. It says, identify existing federal advisory groups, committees, and work groups that are focused on preventing and ending homelessness, and seek ways to expand membership to include people with lived experience and for ensuring meaningful participation and compensation for their time and expertise. And that was talked about already quite a bit during the panel, but how important it is to authentically make that work. I was at a community recently, and they were talking about looking at the issue of mostly broken down recreational vehicles around city right-of-ways area and what to do about it and some of the issues around it and how to get people connected with services and what are the enforcement related things, how does that impact the people who are living in the RVs. I mean, all these questions have come up. There were a lot of people in the room. I wasn't sure in that room there was anyone who has ever lived in an RV to tell and give advice about what could work or what would not work. And what a waste of time it could be that you go down a path saying, well, let's do this, whatever this is, without realizing there's a key component of it that has a fatal flaw in it, and have only had someone in the room who was comfortable to be able to say, this is the reality on the ground, and this is the thing that could be the incentive versus other issues. That is so, so, so important. I think we've done that quite a bit in certainly in the federal level, right? Decades of policies that, whether advertently or inadvertently, has created an inequitable solution or issue where we know that more people of color experiencing homelessness than is proportional to the population in that community. That did not happen by accident per se, right? There were definitely some policies that were definitely put together in ways that purposefully made those issues, made those results occur. How do we turn that around? How do we include people involved who are directly impacted by those policies into finding those solutions long term?
Yeah, I think one of the things that in looking at the plan that I was thinking about for this group, right, is that it includes a lot of words, right? There's a lot of activities in there. There's a lot of projects going on. And I think that is useful information for people to have. But more than that, I think the thing that I hope people take away is like the potential for the state to be a partner in this work, right? Because ultimately it is you all who are on the ground doing this work, and you all that need to be supported and sort of know what support you need. So I guess my takeaway is like, we want the engagement, we want your critical eye, we want your thoughts, we want your, experiences to inform the work that we're doing. And we are actually actively sort of expanding the role we hope to play in partnership, like with specific local communities. I mean, we luckily have a very good partnership with Monterey San Benito counties. We have some of our staff are from the area, so shout out to them. But just like across the state, right? We want to be informed by your all's experiences, so that where we can make change and where we can coordinate across departments and where we can streamline and direct funding, that's what we're doing. So if there's one takeaway, it's we want your engagement, we want your thoughts. So yeah, thanks for hearing us out.
I think the one thing I want to highlight is that it's everything. You can there's not just one thing you can do to fix this issue or to resolve this issue. You can do all the great work, provide the nutrition assistance, the behavioral health services, help someone be stable in their life. But then if you don't have enough sufficient housing or housing that's appropriate for them available, they're going to continue to go down that path to homelessness. You can have these strong accountability provisions, but if you don't have the data that's tracking the work you're doing and helping inform, different improvements you want to make, again, it's not going to work as well. You can do the great outreach that's needed and connect with the individual, and they may be ready for those services. They're ready to move to a different phase, but then if you don't have the economic pathway for them to be able to follow through on that and make that commitment and have those opportunities. So again, I think you all know this, but that's what's reflected in our plan, and certainly what we want to highlight is just the continued nature to be comprehensive in our work and to engage on all aspects that are needed, because it's critical and vital.
Thank you so much. Genevieve.
Yeah, I would say if you work at a city or a county, get to know your unhoused neighbors. They're your residents as well. They're your constituents. Go with your local outreach team, with your local police. Monterey Cat team is here. I want to give them a shout out. They do such a wonderful job of doing outreach. Y'all deserve those applauses for sure. But definitely start connecting with your unhoused residents. Like, talk to them. They're just as important as any of your other constituents. The only difference is that they don't have shelter. And so we want to make sure that we're connecting with them. For example, in our last local point in time count, we saw that 80% of Monterey County residents were from Monterey County before they ended up homeless. So not only get to know your unhoused residents, but also help us break the stigma. There's a heavy fog of stigma around homelessness, and I think everyone can talk to about in here that it's not. There's not one way, shape, or form that folks experience homelessness. It is families, it is children. There's folks, there's veterans, there's so many different folks that are affected by homelessness. And we know, I'm sure everyone in here can say that it's hard to make rent sometimes, and it's really inaccessible to even buy a property here, right? So for folks that have gotten not a super great hand right from the beginning, it makes it that much harder. If, we're making, an income that is passable and we're having trouble, how can folks that haven't gotten the best hand at first can do that? So get to know your constituents without shelter. Talk to your services providers if you're, and I would say to services providers, y'all are doing a great job. So no notes there. Y'all are amazing. And I'll leave it at that, actually.
Thank you. So there's a couple of things that I want to say is inside of your program, there are QR codes for all of the plans. Please educate yourself, educate your neighbors, educate your colleagues. There's so much going into understanding the complexities of homelessness, and we need to take everything we learned today and spread the word, because NIMBYism spreads very fast. So we got to get in front of the NIMBYism. We have numbers that show that collaboration works. Since 2019, our community has seen a 28% decrease in homelessness. We're well on our way to the 50% mark. And I tell everyone, we didn't get there by doing nothing. We got there by doing every single thing we possibly could do and think of, and we continue to learn from the last year and keep pushing. So we have a little bit of some time left. Does anybody have any questions that you want to ask? I didn't think we were going to have time for this. Oh, Mr. Powell.
Yeah.
Coming from a local jurisdiction that's really benefited from the Cal ICH funding, as well as the home key projects, bureaucracy is real and chasing money is very real. And so I'm concerned about the logistics of that change and what that means for jurisdictions applying. And also a secondary question is, family homelessness is huge. We have a share center with over 300 families on a waiting list. And this is a long-term facility that's meant as a navigation shelter. So I'm curious about funding that's particularly targeting families in the future.
Yeah, thanks for that question. And I'll admit from the start that I am not our grants expert, so I'm not exactly the right person to answer those questions, but I will do my best, and we can talk offline as well, or after this as well. There was legislation that was passed this year that will take the grants from the grant portfolio from Cal ICH and move it to our sister department, HCD, so Housing Community Development. There aren't a ton of details about that yet, but what I will say is that the folks implementing our programs now are the folks that are planning to implement those programs going forward, as far as I understand. So I think what we are hoping is that, like, for the end users, of course, as we talked about, things don't feel that different. And I also will say that, like, something that we as Cal ICH are, like, we'll have an increased focus on, right, is not just our own grant programs, but what are the things we're hearing from our, local communities that were successful about our programs that we can then talk about with all of our council member departments and agencies, right? Like, what are the successes we're seeing in tribal engagement, for example, with our tribal HAP grant program, that we can then take from that program and say, hey, actually, we think that all of us should be working sort of in the same way. So I don't have tons of answers about how exactly it will change in that way, but that's our hope, is that we shift our focus slightly from just, like, our own work, right, to actually the work of the whole state. And then in regards to family homelessness, I don't know about future funding. Like, I don't have a finger on the pulse of that necessarily. But I do think for us, right, calling out families, calling out what we're doing specifically for families is going to be a really crucial part of our new strategic planning process, right? As there are specific subgroups of this population that we know needs specific interventions, like, acknowledging that in our plans and identifying who's going to be doing that and what funding is available for that is going to be really important. So thank you for calling that out.
Can we get a mic over there, please? Yes, you can, Ms. McPherson. 129. Yeah. What are the... Yeah, so it's an assembly bill. So it's a trailer bill. So what happens is they'll say, this is what we're going to do, HHAP funds, right? So we talked about HHAP. And then there will be a trailer bill that comes behind it that defines what does HHAP look like. So we have, in our community, Monterey County gets not that much. It's a little bit, what is it, like $3.5 million a year-ish, which is going down because we are reducing homelessness. And that is a whole different conversation we'll have on a whole different day. But the continuum of care also gets money. So basically what AB 129, actually, does the state want to say what it is? I just started talking. Okay. So, my bad. So AB 129, basically, like they had said, means that our communities are going to have to work together. A component is we have to enter into a memorandum of understanding with our continuum of care as the County of Monterey. Our continuum of care is 2 counties, so they have to do this twice and do it with San Benito County as well. There's also another piece that says we have to do a minimum of 3 community input sessions where we talk to stakeholders like we are today and understand what everybody else thinks we should be spending the money on, and are there interventions that's missing in our community? Are there things that we're doing really well? It also requires that we look at how are we performing. Like, so last year we took a snapshot of our system to say who's experiencing homelessness. And then we're going to look at it again this year. This year, it also adds an extra layer of complexity because we're looking at disparities as well. And we have to create a coordinated plan with the continuum of care. So those are the main highlights of AB 129. I know you guys love reading this stuff, so all of it is available online. And also, you know, federal literature is one of my favorite things to read. So really get into it, understand it, because it'll make us so much better. You know, we're doing a great job at spreading the word, but we need your help to continue spreading the word. We only have a few more minutes. If you have not adopted the plans, the Lead Me Home plan, and you work for a jurisdiction, please do that. Say you're on it. Okay, we have a couple more questions. We have 1 minute. Room for one more question. I do want to go to Jago. I'm sorry, I saw his hand first, Katie. So do you want us to talk about, to answer the question, or was that more of a comment? I see you. I think we're out of time. But I see you, Jago. And we have been doing racial disparities analysis. The last one, I do believe, if it's not on the coalition's website, you can certainly reach out to them and ask for it. We're seeing improvements. It's still not enough. We still have to keep going. When I was at the coalition, we were able to predict if you were going to become homeless just based off of your skin color. People who are Black were 12 times more likely to become homeless in this community, which actually outperforms the state in large, but it's still too much. It should not happen. So anyway, off the high horse again. Thank you all so much, and thank you.
Hi, everyone. Hi, I just wanted to make a quick announcement. First of all, I just wanted to thank our panelists. Thank you so much for that wonderful and insightful conversation. Thank you. And my name's Mahnur. I work with the Coalition of Homeless Services Providers, and I just wanted to thank all of you for coming here and joining us for the summit and making this very special. Now I'm going to say something that's going to make you all very happy. We're ready for lunch. Our lunch is provided by Dorothy's Place and their very talented Red Artichoke team. So please join us for lunch, and we're excited to have you all here. We will reconvene at 12:30 p.m. for a presentation here from the UCSCF Benioff in the Salinas room, and for a conversation with our residents with lived experience in the Vista room. So make sure that you stay tuned, and we'll see you after lunch, and have a great lunch. Thank you so much for coming and joining us. Thank you.
Testing. 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 Hello.
Mic check. 1, 2, 3. Mic check. Mic check. Mic check. Mic check. 1, 2, 3. 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 let's just try and let you talk regularly.
Testing, testing.
Okay, you're solid.
Great. Okay, perfect. Thank you.
All right, everyone, we're going to get started in 5 minutes. In the Salinas room, we will be having a conversation with Tiana Moore for UCSF Benioff. And then in the Vista room, we will be having reflections from those with lived experience. So please grab your seats, start trickling in. We are going to be starting in 5 minutes. Thank you, everyone. All right, everyone, we're getting ready to get started. Come back to your seats. I know lunch was delicious. Feel free to keep enjoying it, but feel free to come back in and trickle in, grab your seats. We're going to get started here in just a couple minutes. All right, everyone, we are ready to get started. It is 12:30. We have no time for food coma, so, get up, shake out your body if you need to. We have a really amazing conversation and presentation by Tiana Moore, the Policy Director at UCSF Benioff Homelessness and Housing Initiative. This year, The UCSF Benioff Homelessness and Housing Initiative released the largest representative study of homelessness in the United States since the mid 1990s, providing a comprehensive look at the causes and consequences of homelessness in California and recommending policy changes to shape programs in response. Please help me welcome the co-author of the report, Ms. Tiana Moore.
Thank you. Oh, we're good now. You would think after all these talks, I'd remember to turn the microphone on at this point. But good afternoon, everyone. My name is Tiana Moore. I am the Policy Director at the Benioff Homelessness and Housing Initiative. We're a research institution that's embedded within UCSF. And within that organization, my primary role is to take the really rigorous research that we conduct and translate it in a way that resonates with policymakers, that resonates with our advocacy partners, so that they can take the data that we have and use it to further their efforts across the state and at the federal level as well. Today, I'm talking about the California statewide study of people experiencing homelessness, or CASPA for short. It is the largest representative study of homelessness since the mid-1990s, as Genevieve mentioned. And we released the report that highlights the study findings in June of 2023. And I believe in the handout that you guys have, there is a QR code that you can scan so that you can access the full report. The full report is about 90 pages, so if you want something that's a little bit of an easier entry point, feel free to look at the executive summary, which has some of our key high-level findings. Next slide, please. So as I mentioned, the CASPA is the largest representative study of homelessness in the United States since the mid-1990s. And it was conducted at the request of the California Health and Human Services Agency at a point in which California was really interested and invested in making some significant investments in homeless services provision and also prevention efforts, and really needed some up-to-date data to really inform those efforts. Some context for some folks in this room, California has about 171,000 people experiencing homelessness on a given night, and we're also home to about half of the unsheltered population across the entire nation. Next slide, please. And while we were conducting the study at the request of Cal HHS, I think it's important to note that we were funding it as well as our partners at the California Healthcare Foundation and Blue Shield of California. And I make this point to let you guys know that we take responsibility for our findings. There wasn't kind of influence from the state in kind of interpretation and dissemination of those findings that we present today. Next slide, please. So just a quick overview of some study methods that kind of ground us before we talk a little bit about the findings. We were all across the state of California, so the numbers that I present today are statewide estimates. We basically took the state of California, carved it into 8 regions, and within each of those regions, randomly selected a county that's representative of that entire region. Unfortunately, the counties are confidential, so I can't share what counties they were, except for Los Angeles County, which is just so enormously, immensely large that it represents its own region. This study was very much interested in kind of understanding the experiences of adults experiencing homelessness. So everyone that participated in the study was at least 18 years of age. Overall, we conducted 3,200 questionnaires with people experiencing homelessness across the state of California, and we supplemented kind of the quantitative data that we got from the questionnaires with these paired in-depth interviews with about 1 in 8 of every participant. We use venue-based sampling, which is really just kind of a fancy term to say that we met people where they were. So we were in places where people experiencing homelessness congregate across the state. We were in encampments, hot shower lines, hot food lines, libraries, places that are typical for folks experiencing homelessness to be. And we also supplemented our venue-based sampling efforts with what we call respondent-driven sampling. And really, this is a technique, a sampling technique that we use to really reach the harder to reach populations. So our transition-age young adults, our LGBTQ plus populations, our farm working populations really relied on kind of the social networks of those participants to really make sure that we had representation from these harder to reach populations. As I mentioned, the study was sample weighted, so we are presenting statewide estimates. We don't have the capability to kind of make sure that we talk about kind of county level estimates. It's always been kind of designated to think about the state as a whole. Primarily, the surveys and interviews were conducted in both English and Spanish. However, if there was a participant who did not speak either of those languages, we used interpreters to really help supplement that. And then finally, and probably most importantly, we really relied on community engaged practices at all points of the study, from conceptualization of the study, development of the survey instrument, kind of interpretation of findings, all the way to dissemination of efforts. It was not a single-handed effort by the UCSF BHHI. We relied on 3 community advisory boards. Next slide. And this is a picture of our study team in the field with some of our partners. Next slide, please. One of the most kind of integral advisory boards that we convened was the Lived Expertise Advisory Board. And this was convened or comprised of folks from across the state with either lived or living experience of homelessness. And they really drove kind of our research methods in a way that we would not have been able to ourselves. So we relied heavily upon them from the beginning until now in the dissemination of data phase that we're in at the moment. Next slide, please. Another key advisory board that we relied on was the Policy and Practice Advisory Board. And this was comprised of leaders from the state level, from the federal level, and at the national level, to really help us think about policy implications, implementation within the field. They were our partners very closely from start to finish as well. And notably, the last advisory board that I don't have mentioned up here is our Learning Collaborative Advisory Board. And these were comprised of folks from the 8 counties that we were in. So I can't share their names without disclosing where we were in those counties. So I do want to acknowledge their contributions. And they really helped us on the ground when we were in those counties to really figure out where to go, where were folks experiencing homelessness at, and also kind of guide our interpretation of data as well. Next slide, please. And so now that we have a little bit of grounding in how we conducted the study, I really want us to talk about some of the high-level findings from the study. Next slide, please. And before we dive into some of those findings, I want to anchor this in a quote that is particularly striking from one of our participants. I've met some really good people out here. Everyone out there in the real world is one paycheck away from being homeless. Next slide, please. And so while we talk about who experiences homelessness in California, it's important to know that homelessness doesn't happen in a vacuum. We are living in structural conditions that are conducive to homelessness within the state, namely the lack of affordable housing within California. And so while we are talking about kind of individual characteristics of who experiences homelessness, it's important to note that they are all living within these structural conditions in which homelessness kind of proliferates. Next slide, please. So in accordance with federal definitions, we categorized our participants in a way that the federal government categorizes adults experiencing homelessness. 90% of our participants were single adults, and these are adults that are 25 and older without a minor child living with them at the time of the interview. 7% were adults and families, and these were adults 18 and over that were currently living with a minor child at the time of interview. And then finally, 3% of our sample were transition age young adults, or TAY. And these are 18 to 24-year-olds that were without a minor child at the time of interview. And I think one point that I really want to hit home is that this particular study is not designed for the transition age youth population. So this is not a statement of the size of the population. We recognize that even with our best efforts to employ respondent-driven sampling and other techniques to really reach this hard-to-reach population, the methods that you use for transition age youth are very different than the methods that you use for adults that are 25 and older. And so this number of 3% should not be interpreted as a statement of the relative size of the TAY population within the state of California. So while we had 7% of adults in our sample classified as adults and families, it's important to note that there are many single adults that had children that weren't living with them at the time of the interview. So among our single adult participants, 30% indicated that they had a minor child that just was not living with them at the time. 10% said that their children were in CPS custody at the time. And I think perhaps most strikingly, 8% said that they had relinquished custody of their child currently due to homelessness. Next slide. So with regard to participant demographics, perhaps unsurprisingly to many in this room, communities of color are greatly overrepresented in homeless populations across the state and nationwide, Black and Indigenous communities in particular. When we look at our sample size, or our sample in the study, 26% of participants identified Black as one of their racial identities. But when we look statewide, it's about 7% of people who do so in the general California population. With regard to Native American, Alaskan Native, or Indigenous identity, about 12% of our participants indicated one of those racial identities. However, when you look at the state as a whole, it's about 3%. And I think it's important to note that 12% is strikingly high, and that number is high even without us kind of visiting tribal lands for the study. With regard to gender, 69% of our participants were cisgender men, 30% were cisgender women, and 1% identified as transgender, non-binary, or another gender identity. When we look at our transition age young adult population, it's about 6% of individuals who identify as trans, non-binary, or another gender identity. The median age of all participants was 47. The youngest person that we interviewed was, of course, 18, and the oldest person that we interviewed was 89 years old. When we look at the median age of just single adults, it's very clear that California's single adult homeless population is aging in particular. The median age of single adults in California was 49. 48% of those single adults were 50 and older at the time of our interview. And 41% of single adults 50 and older at the time of interview first became homeless at 50 or older. So they were just experiencing this kind of late onset of homelessness. Next slide. Episodes of homelessness were long. The median length of the current episode of homelessness across all of our participants was about 22 months, so very close to 2 years. And 1 in 3 participants met federal criteria for chronic homelessness. So this requires both this kind of temporal criteria, so the duration that you're spending your current episode of homelessness, and then also a disabling criteria that's paired with it. So a little contrary to a lot of mythology around kind of where folks experiencing homelessness in California are coming from, 9 in 10 of our participants lived in California when they lost their last stable housing. So participants that we enrolled were from California. 3 in 4 of our participants lived in the same county as their last stable housing. So participants aren't moving these great distances from where they last lost their housing to where they currently are experiencing homelessness. Often they have networks and kind of other ties to that community that they're living in. And so that you don't see these kind of great distances that I think some people may assume. Next slide. So now I want to talk a little bit about trajectories to homelessness and the pathways by which people experience homelessness. Next slide, please. So trajectories to homelessness differ. When we think about kind of the entrances into homelessness across our study population, about 1 in 5 of our participants entered homelessness directly from an institutional setting. About half of our participants entered homelessness from what we call non-leaseholding arrangements. So these are folks that are living doubled up, living in informal arrangements in which their name isn't formally listed on a lease and doesn't necessarily confer the same legal rights as someone who might be a leaseholder. About 32% of our population came from what we call leaseholding arrangements. It was primarily rental agreements that people had their names on. About 3% of our population came from a mortgage holding situation. Rental agreements were far more common. And I should say, with regard to our folks that were coming from these institutional settings, it was primarily from extended jail stays and primarily from prison stays. High housing costs and low incomes leave folks incredibly vulnerable to homelessness. The median monthly household income in that 6-month period prior to homelessness across our participants was just $960. The median monthly housing cost across all of our participants in that 6-month period prior was about $375. But what this number obscures is that many of our non-leaseholders weren't paying rent in their last housing. When we look at the non-leaseholder-leaseholder difference, with regard to non-leaseholders, the median monthly household income was $950. And as I mentioned, 43% of our participants didn't pay rent in their last housing situation. But amongst those who did pay rent, the median monthly housing cost that they paid during that period was $450, so about half of what their income was in that period. With regard to leaseholders, it's kind of the same story, just a little bit higher income and higher housing costs. So the median monthly household income among our leaseholders was $1,400. The median monthly housing costs were $700. So again, paying about 50% of your very low income to begin with on housing costs. Participants had very little warning prior to losing their last housing. Across all of our participants that came from housing, the median warning that they said that they received before they knew that they were losing their housing was just 5 days. When we look at non-leaseholders, it was a single day that they reported. And amongst our non-leaseholders, I think we were all particularly surprised by this, but 10 days was the notice that they reported. And I think it was especially surprising because of the legal protections that renters have in California. But what we kind of untangled from our qualitative interviews is that people left at the threat of eviction even before a formal eviction was really filed. Next slide, please. So we asked our participants to both tell us a little bit about what you contribute or what you attribute to the reasons that you left your last housing. And we also asked them to identify what they consider the primary reason they lost their last housing. When we look at all participants, about 12% indicated that lost or reduced income was their primary reason for leaving their last housing. Next slide, please. When we look at our non-leaseholders versus our leaseholders, the story differs a little bit. So for our non-leaseholders, these kind of interpersonal reasons, so conflict among residents or didn't want to impose or wanted your own space, really emerged to the top as some of the primary reasons for leaving their last housing. And what really became clear in the qualitative interviews that we conducted is although individuals were kind of naming these very recent and immediate kind of interpersonal conflicts as the reason that they lost their last housing, there was some economic shock and economic factor, economic precarity that really preceded that caused them to live in these kind of tenuous situations that were overcrowded and not kind of an ideal housing situation. So while they kind of identified this immediate interpersonal reason, it really is clear that an economic upstream cause really precipitated their downward trajectory into less than ideal housing situations. Next slide, please. When we look at our leaseholders, about 1 in 5 leaseholders indicated that lost or reduced income was the primary reason they left their last housing. Next slide. And while we asked our participants to identify one primary reason, it's very clear that multiple reasons often intersect and compound each other to make someone vulnerable to experiencing homelessness. And so I wanted to share this one quote with you from one of our participants that highlights this kind of intersecting factors and the relationships between these intersecting factors that contribute to homelessness. Basically, I just didn't have enough income. You have to have first, last, security deposit, and I didn't have all of it. And then the disability. After my parents died, I was on my own. So then I really started to suffer and see all the hardship you have to go through to get housing and with a disability. Next slide, please. So we wanted to understand the types of help and support people sought prior to experiencing homelessness. Pretty strikingly, about 1 in 3 of our participants, only about 1 in 3 of our participants indicated that they sought help from any source during this period prior to homelessness. And this was most commonly from friends and family. About 23%, or a quarter of our participants, indicated that they received help. And I want to just make sure that we kind of contextualize this in the context of the median warning that people are receiving prior to losing housing. When you have 5 days of notice, 1 day of notice, or 10 days of notice, it's incredibly hard to really think about kind of seeking help in that very short time period. Next slide. So I want us to kind of think back to the 1 in 5 participants who entered homelessness from an institutional setting. We asked our participants about support that they sought upon exiting those institutions. I'm presenting data on exits from prison and jail because those are the primary institutions that people that entered homelessness from an institutional setting came from. We asked participants about help they received when exiting jail or prison with regard to signing up for government benefits, signing up for healthcare services, and also identifying housing. With regard to benefits, 19% of participants who exited jail and 18% of participants who exited prison reported receiving help upon exit of those institutions. With regard to healthcare, 17% of folks exiting jail and 14% of folks exiting prison received help signing up for healthcare services. And then finally, 17% of folks exiting jail and 14% of folks exiting prison indicated that they received any help finding housing upon reentry. Our participants were pretty optimistic about financial interventions that would have kind of durably prevented their homelessness. We asked our participants to kind of recall the period prior to their experience of homelessness and think about whether or not 3 financial interventions would have helped stave off their homelessness for at least 2 years. We weren't interested in kind of smaller periods of time. We were interested in thinking about what might have durably averted their episode of homelessness. We asked participants to consider 3 interventions, the first being a $300 to $500 a month shallow subsidy, the second being a $5,000 to $10,000 a month one-time payment, and the final being a housing voucher similar to a housing choice voucher, which limits your contribution to rent to 30% of your income. 70% of our participants thought that a $300 to $500 a month shallow subsidy would have helped avert their homelessness for at least 2 years. 82% thought that that lump sum payment, that one-time payment of $5,000 to $10,000 would have. And then 90% of our participants thought that a housing choice voucher or something similar would have helped stave off their homelessness for at least 2 years. So now let's talk a little bit about experiences during the current episode of homelessness. Next slide, please. And I want to start by sharing this quote that one of our participants shared with us. Most of the time, we're running around trying to figure out where we're going to sleep at night or how we're going to be housed, or it's about to start raining soon. And we worry about that. We're not worried about going to the doctors or going to see somebody or going to get help with our mental state. Next slide. So most of our participants spent most of their time in the past 6 months unsheltered, 78%. But what I think is also important is that at least 90% of our participants spent at least one night unsheltered during the current episode of homelessness. With regard to where folks spent the most time in the past 6 months, 21% of our participants spent most of their time in a vehicle. 57% spent most of their time in a non-vehicle unsheltered location, such as an encampment, living in a tent, in an abandoned building, or another place that's not meant for human habitation. And then finally, 22% of our participants were in a sheltered location, primarily in the past 6 months. 41% indicated that there was a time in which they wanted shelter, but they weren't able to access it during the current episode of homelessness. Next slide. So participants in congregate shelters generally reported being satisfied with their living arrangement. However, when you talk to folks who were unsheltered, a few concerns about shelter arose. And these concerns were related to health, so COVID-19. I should have shared that we were in the field from November 2021 until October 2022, and so kind of the peak of the COVID-19 pandemic. Burdensome rules. Oftentimes we talk to participants and they just want to be treated like everyone else. They want to be able to kind of go and be able to live in a place that does not kind of restrict their movement in the same ways that some shelter rules might. We also heard from our qualitative participants that oftentimes some of the burdensome rules actually impeded their ability to work because of their kind of non-standard work hours. And then finally, they didn't perceive congregate shelters as useful resources to actually find permanent housing. Next slide. The health of our participants was extremely poor. Self-rated health is often used by researchers to really predict kind of future mortality and future hospitalizations. Fair or poor health status in particular are the two metrics that kind of indicate these kind of future adverse health outcomes, so future hospitalization, future mortality. 45% of our participants indicated that their health was fair or poor. And to situate this amongst the general kind of US population and what they report, it's about 14% of the general US population that reports fair or poor health. About 2 out of every 3 of our participants had at least one chronic health condition. And then finally, about 1 in 3 of our participants reported a difficulty with an activity of daily living. So the ability to dress yourself, the ability to walk across the room, all kind of related to functional ability. Next slide. Perhaps one of the most striking findings that kind of took our breath away as a research team was the findings that we had around pregnancy. So of our participants who were assigned female at birth and that were under the age of 45, 26% of those individuals were pregnant at some point during the current episode of homelessness. And further, 8% of those individuals were pregnant on the day that we interviewed them. 83% of our participants were covered by some form of health insurance, and this was most commonly Medi-Cal. And 52% reported having a regular place of non-emergency department health care. 61% said that they saw a healthcare provider outside of the emergency department in the past year. And despite these kind of high levels of insurance coverage, that doesn't necessarily translate to what we see in terms of patterns of acute care utilization. And in the past 6 months, 38% of our participants had visited the emergency department. And to just situate that fact a little bit, when you look at the general US population of adults that are 18 and older, 19% of adults 18 or older in the US visit the emergency department in a year. So that's a pretty strikingly high finding, contrasted finding. 21% of our participants had an inpatient hospitalization for a physical health reason, and then 5% of our participants had a recent psychiatric hospitalization, so a psychiatric hospitalization that happened in the prior 6 months. So 66% of our participants indicated at least one mental health one mental health symptom. I think it's important to note that we asked about kind of symptomology, given kind of disconnections from the healthcare system, and the likelihood that someone might be kind of suffering with a mental health condition but not have a formal diagnosis for it. And while 66% of our participants indicated at least one mental health symptom, this was primarily driven by anxiety and depression. So 51% of our participants indicated that they had experienced symptoms of anxiety in the past, during this current episode of homelessness, I should say. 48% experienced depression, and 37% experienced trouble remembering, concentrating, or understanding, which can be kind of a symptom of an underlying cognitive condition. And then finally, 12% said that they had experienced hallucinations recently or during the current episode of homelessness. When we think about hospitalizations for mental health conditions, 27% of our participants had been hospitalized for a psychiatric reason in their lifetime. 44% of these participants indicated that the first instance in which they experienced that kind of psychiatric hospitalization was after their first homelessness episode. Next slide. So we asked participants a range of questions to really understand their relationship with illicit drugs and also alcohol. And we were interested in kind of current regular use of illicit drugs. With regard to that, 35% of our participants had used at least one illicit drug on a current regular basis during the current episode of homelessness. And this was primarily driven by methamphetamine use. 31% of our participants indicated that they used methamphetamines 3 times a week or more. 3% of our participants indicated that they use cocaine 3 times a week or more, and 11% use opioids, non-prescription opioids, 3 times a week or more. With regard to heavy episodic alcohol use, we were interested in kind of understanding what those patterns looked like on a weekly basis. And heavy episodic alcohol use is just kind of binge drinking. 9% of our participants indicated that they kind of binge drank on a weekly basis. Most of our participants who used opioids were also using methamphetamines. And then finally, 11% of our participants experienced an overdose that required medical intervention of some sort during the current episode of homelessness. Next slide. With regard to kind of understanding the reasons for substance use, we kind of looked to our qualitative interviews. And what really came through is that many of our participants indicated that they were using substances like methamphetamine to stay alert, to stay vigilant, to stay awake while they were unsheltered. And so I wanted to share this one quote from a participant that kind of touches upon some of those themes. For the most part, the drugs that I do, I stay up, I stay focused, and it keeps me with a numb attitude. It keeps me out of reality. And when you're sober, you come back to reality, and that hurts. You feel it more when you're sober. To tell you the truth, I think sober, for some people, it's worse. That might be the worst thing for them, being on the streets, being sober. I think me and my situation, I think the choice, The little drugs that I do, it really helps me. It keeps me sane. I can't do this. I can't deal with always being harassed by the police. I can't deal with the normal citizens that got places to stay, that have 9 to 5s, that's taking care of their kids. I can't be normal around them if I'm sober. And so while participants talked about kind of using substances as a way to kind of stay vigilant and maintain their safety, many also talked about using substances as a way of self-medicating themselves. Next slide. Homelessness limits access to behavioral health treatment, and I think this is particularly important to keep in mind as we have these kind of current conversations in California about forced treatment. 35% of our participants who reported current regular illicit drug use or weekly heavy episodic alcohol use indicated that they wanted treatment but weren't able to access it. And then when thinking about kind of the mental health symptomology that we talked about, only 18% of our participants received mental health counseling or psychiatric medications in the past 30 days. Next slide. So we have been trying to kind of noodle with our data a little bit to understand what proportion of our participants might need a little additional support when they're in housing. And so we looked at kind of acuity measures of substance use and also of a mental health condition. So we looked at all participants who reported either current regular illicit drug use, heavy episodic alcohol use on a weekly basis, current hallucinations, or a recent psychiatric hospitalization. And across our participants, 47% of our participants indicated that they had either of those kind of conditions. So would probably need a level of support that permanent supportive housing would be able to support. With regard to incarceration, our participants had high levels of carceral involvement during the current episode of homelessness. 30% of our population went to jail during the current episode of homelessness. And this is probably a little bit of an underestimate, because if you have a jail stay that lasts longer than 3 months, your episode of homelessness automatically kind of is considered to start again. And so these are just the 30% of our participants who had gone to jail during the current episode of homelessness, and the jail stay was a short-term jail stay. Our participants experienced high levels of violence enacted upon them during the current episode of homelessness. With regard to physical violence, 1 in 3 of our participants indicated that they had experienced a physical assault during their current episode of homelessness. And of those participants, about half indicated that the perpetrator of that assault was a stranger. When we look at sexual violence, about 10% of all of our participants indicated that they had experienced sexual violence during the current episode of homelessness. And again, when you look at who the perpetrator of that sexual violence was, 54% of our participants who experienced that sexual violence or sexual assault indicated that the perpetrator was a stranger. And I think this is an important contrast when thinking about kind of the perpetrator of violence. We asked this question of our participants about kind of their lifetime experiences of violence and violence experience prior to homelessness. And oftentimes participants indicated that the perpetrator of that violence during that period before homelessness was someone that was familiar to them. Whereas while they're experiencing homelessness, that perpetrator was often a stranger who was not familiar to them. Next slide. With regard to labor, employment, and income, we saw very lengthy disconnections from the workforce across our participants. And these are both kind of the informal and formal labor markets. 70% of our participants hadn't worked 20 hours a week or more in the past 2 years. However, many of our participants were actually actively looking for work at the time of the interview. So 44% of our participants indicated that they were actively looking for work. When we look at just who we might consider kind of workforce eligible, so folks who are younger than 62 and without a physical disability, about 55% of those in that kind of category said that they were actively looking for work. Participants' income during homelessness was only about $400 on the median. And we also saw kind of great underutilization of income benefits. So we saw pretty high enrollment in CalFresh, which is California's SNAP program, but we saw pretty low rates of enrollment and participation in any other program designed to kind of boost income. So SSI, SSDI, G8, or General Assistance, General Relief in California was also incredibly low. And so finally, before kind of the call to action that I have for everyone in this room, I want to talk a little bit about some of the barriers and facilitators of returns to housing that our participants identified. Next slide. So nearly all of our participants indicated that they wanted permanent housing. We were hard pressed to find anyone who told us that they didn't. And also nearly all indicated that the primary barrier to actually accessing permanent housing for them were high housing costs. So 89% of our participants indicated that high housing costs were a key barrier to them exiting homelessness. 57% of our participants indicated that the housing that they could actually afford was either too far or too unsafe for them. We asked about a whole host of other barriers. With regard to kind of the logistical administrative barriers, 53% of our participants indicated that not having these kind of housing relevant documents posed a barrier to them exiting homelessness. 52% indicated that wait lists being too long posed a really considerable barrier to them exiting homelessness. 51% indicated that family or friends not being able to kind of take them in and have them live with them was a barrier to them exiting homelessness. And about half indicated that a poor credit history, or a past eviction posed a barrier to them exiting. 43% of our participants indicated that identity-based discrimination, whether it be racial discrimination or discrimination based on their housing status, posed a barrier to them regaining permanent housing. About 1 in 3 indicated that a carceral record posed a barrier to them exiting homelessness and regaining housing. And about 29% indicated that their mental health or their substance use, so these kind of behavioral health needs, posed a challenge to them accessing permanent housing. And about 24% indicated that having a physical disability and finding housing that was suitable to meet the needs of their physical disability was a barrier to them finding housing. 63% indicated that not having someone to help them find housing was a barrier. So there was this hunger, this need for housing navigation, for case management, for support to actually find permanent housing solutions. 46%, so about half of our participants, received kind of formal assistance finding housing during the current episode of homelessness, but this support wasn't very frequent. So 26% of our participants indicated that they received help finding housing either monthly or more frequently in the past 6 months. And there was a very clear difference when we looked at our unsheltered participants versus our sheltered participants. So 44% of our sheltered participants indicated that they received help finding housing on this kind of monthly or more basis. And 20% of our unsheltered participants said that they received this help with that frequency. Next slide. As one participant shared, there's just not enough resources out there for people who want to get out of being unhoused. You kind of just seem like you're stuck there. Even if you're trying to get a job, like you have to have an address. And if you don't have an address, you can't get a job. If you can't get a job, you can't stop being unhoused. Next slide. So similar to the thought experiment that we engaged our participants in with regard to prevention and interventions that would have kind of prevented their episode of homelessness, we also engaged them in a similar thought experiment about what interventions might have helped them kind of meaningfully support their return to permanent housing. We asked about the same kind of financial interventions as we did in the prevention thought experiment, but we also asked about having housing navigation as a support and whether or not folks saw the utility of that. With regard to the monthly shallow subsidy, 86% of our participants indicated that that would help them meaningfully kind of regain their housing. Is one support that might help them regain their housing. 95% of our participants thought that a $5,000 to $10,000 kind of one-time payment would help them do so. And this kind of difference between the shallow monthly subsidy and the one-time payment is probably attributable to the fact that you have to have first, last month's rent, security deposit, all these kind of upfront housing costs that pose a barrier to entering permanent housing. With regard to a housing voucher similar to a housing choice voucher, 96% thought that this would actually meaningfully support their return to housing. And 94% of our participants thought that having a housing navigator or someone that's kind of designated with helping them find housing would help meaningfully support their return to housing. Next slide. So now I want to just kind of take some time and talk through some of the high-level policy recommendations that we have. This is by no means an exhaustive list. If you're interested in kind of the full scope of policy recommendations that we have, I highly suggest taking a look at the full report. But there are a couple of high-level findings or high-level recommendations that I just want to amplify within this room today. Next slide. So first, we have to be committed to doing all we can do to increase access to affordable housing options. I want us to recall that the median monthly household income in that 6-month period prior to homelessness for our participants was just $960. And the housing costs were about half of that. But the challenge that people had was once they lost their housing, it's nearly impossible to replicate that at the amount that they were paying before. So we need to think about expanding deep rental assistance programs, housing choice vouchers, thinking about amplifying and expanding the availability of housing choice vouchers, the availability of similar rental subsidies that really limit the amount that someone has to contribute to their rent to make sure that it's parallel to what they can afford. We need to think about ways to support usability of existing subsidies. Many of our participants shared that even though they might have had a rental subsidy, they need that extra support to actually find it. And also many of our participants talked about discrimination that they faced in the housing market. And so doing anything that we can do to really support the usability of those housing markets on the rental market is incredibly important. We need to think about incentivizing housing production, both using existing mechanisms that we have in place and also rethinking ways to use the building infrastructure that we have now, the land that we have right now. Many of our participants were open to the thought of shared housing as a way to kind of expand availability of housing available, but what they really highlighted was the need to make sure that this was paired with mechanisms that give them agency and choice of who they live with to make sure that there's a good match. And then finally, about 50% of our participants entered homelessness from these non-lease holding arrangements, often living with family or friends. We should think about piloting monetary support to facilitate shared housing with family and friends. What we saw, and I think it comes a little clearly through the notice that people had that are in these non-leaseholder arrangements, is that oftentimes a person wasn't able to financially contribute to rent, which caused tension within the household, which ultimately precipitated their homelessness. And so anything that we can do to increase that total household income, including piloting monetary support, is incredibly important. Next slide. We need to expand targeted prevention. We put our participants through these thought experiments, and while they might have been overly optimistic, we think that it's a pretty good indicator that, thinking about some of these interventions as a pilot might be a good way to go. So thinking about piloting that $300 to $500 a month monthly subsidy, thinking about piloting these kind of lump sum payment programs as a means to prevent homelessness, something that we should explore. We need to think about ways to slow down the process, right? So people lost their housing and they lost their housing quickly. So we need to think about incentivizing property owner and tenant mediation processes to really think about ways to divert someone from experiencing homelessness. We need to think about increasing homelessness prevention in these institutional settings. About 1 in 5 of our participants entered homelessness directly from an institutional setting. We know where people are when they are exiting these institutions, and it's a great opportunity to think about embedding more robust ways to support folks into permanent housing when exiting these institutions. And we also need to think about expanding prevention in these mainstream systems where extremely low-income individuals often receive services. Next slide. So as I mentioned, about 47% of our participants indicated some level of higher acuity behavioral health need. And so we need to make sure that we are matching the services and supports that we have available to match the behavioral health needs of this population. And that includes increasing access to substance use treatment, increasing outreach with harm reduction services, investing in promising treatments for stimulants. As I mentioned before, 11% of our participants experienced an overdose during the current episode of homelessness. So it's a matter of life or death to think about these interventions. We need to also link harm reduction and substance use treatment to emergency departments. We had high levels of folks, 38% of folks who had been to an emergency department in the past 6 months. That's a great opportunity to think about intervening with these supports that they might need. We also need to increase the availability of permanent supportive housing, and also not just increasing the availability, but making sure that the services that are embedded within permanent supportive housing actually meet the level of need of the population that's living in that particular community. And then finally, we need to think about increasing access to mental health care. Next slide. Increasing household incomes is an important part in homelessness prevention and also in getting folks back to permanent housing. We need to think about increasing evidence-based employment supports. Many of our participants indicated that they had kind of logistical challenges in accessing a place of employment, such as transportation. We also have to think about ways to creatively enroll or creatively increase enrollment in income eligible benefits. And one of the ways that we were in the field for about a year, and we had tablets and hotspots, and we're able to conduct the studies thinking about outreach or affirmative outreach to people that are currently experiencing homelessness, and getting them signed up for benefits is an incredibly important thing. Next slide. We also need to increase outreach and service delivery to those who are currently experiencing homelessness. This includes street medicine. There's high levels of physical health needs that our participants had. And it also invests in sustained outreach to our unsheltered communities. What we heard loud and clear from our participants, who are especially our unsheltered participants, was feelings of abandonment, feelings of disconnection. And so thinking about ways to really try to make sure that we increase the reach of our services to people who are currently experiencing unsheltered homelessness. Next slide. And finally, something that I think should undergird any effort with regard to prevention or with regard to getting someone back into permanent housing, we need to embed a racial equity approach in every aspect of homeless system service delivery. We need to think about strengthening anti-discrimination policies and enforcement mechanisms. As I mentioned, 43% of our participants indicated that discrimination was a key barrier to them entering permanent housing. We also need to prioritize equity in local coordinated entry systems, making sure that we're not unintentionally exacerbating some of the disparities that we see already by the ways in which we conduct coordinated entry. And then lastly, we need to lower housing barriers for those with criminal justice system records. Our population has high touch or frequent touches with the carceral system. And so thinking about ways to ensure that folks that might have a criminal justice record are still able to obtain permanent housing is critical. Next slide. Thank you all so much. I'm happy to chat a little bit more about the study after this talk, but I appreciate everyone's time and really encourage everyone to take a full look at the full report, and also reach out to us if you have any questions or if we could ever be of need. Thank you so much.
All right, everybody, can we get another round of applause for the amazing Tiana Moore, everyone? Thank you so much for making it down here from San Francisco. Really appreciate it. Starting back up at 1:45, we will be hosting a conversation in the gallery room that will be moderated by Lavisha Franklin, which will explore historical inequities to housing access. In the Vista room, we will be hosting a local input session on our local community plan. And where you are currently, we will be hosting a conversation about health and housing with a panel moderated by Catherine Ector. So we will see you back at 1:45, everybody. Thank you so much. All right, everyone, we're going to be starting in 10 minutes. 10 minutes with a conversation on health and homelessness in the Salinas room, equity and housing access in the gallery room, and then local community input session in the Vista room. Not Gabalin, Vista. All right, thank you, everybody. Please find your seat and let's get ready for some learnings. 1, 2, 1, 2, 1, 2, 3. Cameras, lights, action. All right, everybody. It is 1:45 as promised. We are ready to start our next conversations. So thank you, everyone. Housing is health, impact on housing and stability and homelessness. That's the conversation that we are having here today that will be moderated by Catherine Ector, the Behavioral Health Director at the County of Monterey. Our panelists are Kate Nestor, the Program Development Manager at Central Coast Alliance for Health. You've all heard Tiana Moore, from UCSF Benioff, and then Rebecca Mitsamaha, the Regional Housing Strategy Program Manager at Anthem Blue Cross. Please help me welcome our panelists as we dive into this conversation.
Thank you all so much. We really appreciate the team of people who are here to help us work on really trying to find creative ways to improve the health and the outcomes for people experiencing homelessness. And I hope that the input of our experts here on the panel can help be some food for thought to help lead us in a direction that we can build solutions. And so with that, I'm going to ask our first question of Tiana, please. What are some of the most significant health challenges faced by individuals experiencing homelessness? And how do these challenges intersect with their lack of stable housing?
That's a fantastic question. Hello? I will project. That's a fantastic question. I think what we saw in our in the last presentation that I gave was just the health status of people experiencing homelessness is extremely poor. 45%, so roughly half of our participants indicated that they had fair or poor health, which is often an indicator of future mortality, of future hospitalizations. And oftentimes, our participants often talked about kind of high rates of unmet medical needs that they had. They talked about prescription needs that they had that they weren't able to attain because of their housing or homelessness status. One of the things that is particularly striking for me from the data from our study are the high levels of functional impairments that people had. So difficulties with mobility, difficulty dressing yourself. And I think that, we're at a pivotal moment right now where we need to think about creating housing that meets the needs in terms of functional impairments and also creating shelter options for people. Because oftentimes what we heard in our qualitative data is that people have these kind of functional needs that shelters weren't able to meet, and therefore they were kind of outside and outdoors because of that. One thing I also underscore is kind of the difficulty of managing chronic health conditions when you're living outside, living unhoused. 60% of our participants had at least one chronic health condition. And I will say that that's probably a great understatement because those are just the health conditions that people know about. Many folks are probably living with chronic health conditions without even knowing. But it's incredibly difficult to manage those chronic health conditions when you don't have stable housing, when you don't have a bed to go to at night. And so the intersection between poor health outcomes and homelessness is very clear.
Thank you so much. Rebecca, would you answer the same question?
Absolutely. This is working. Fantastic. So, adding to Tiana, and, I think speaking to maybe a quote from one of your study participants that when you're living on the street, and you're navigating kind of your daily situation, asking someone to navigate a really complex health system to, access an app or have access to technology. We know a lot of participants kind of have intermittent access to technology, can be really difficult to access those healthcare services. Something else that we often see is lost and stolen medical equipment. And just adding to kind of what you were saying, I saw a recent review of the comprehensive review of literature, and again emphasizes that we're seeing kind of frailty and geriatric conditions of individuals experiencing homelessness at 40 and 50 that we'd normally see in the general population at the ages of like 70 or 80. So that accelerated aging is really impacting this vulnerable population.
Thank you so much. And Kate, would you please add your perspective?
Is it on? That is not as good of a microphone. Thank you.
So at the Alliance, I think what's really important for us is that we understand the health concerns of our members based on the data available. And so we're really leaning on the HMIS administrator and the COC and the data that they have available in order to better understand what someone experiencing homelessness might benefit from in terms of supports and services. And so really it's for us, it's collecting the data and then identifying the services that we can provide.
Thank you so much. I also want to add, from the behavioral health perspective, there are a couple of things that we know. I mean, and even though, only, 29% of the individuals surveyed, according to the Benioff study, indicated that they had a mental health condition. Just imagine what your mental health condition would be if you lost your job, if you lost access to your financial resources, and if you didn't have friends or family who could help you out. You tell me what your mental health condition would be in a month, in 6 months, in a year. And, nobody has to raise their hand on this one, but who would consider self-medicating with substances in order to help cope with that space that you would find yourself in? So the reality is, we know, yes, there's a housing problem. And yes, we know that there is a behavioral health issue that is facing people with the homeless problem. And the reality is that every single one of us would have a behavioral problem if we had that same set of circumstances. So as we think about chicken and the egg, we need a place for people to be and to be safe, to be able to connect them to services. And then there's a path for recovery. Because we can think about, Maslow's hierarchy. And I think one of the quotes from one of the participants, again, said, hey, I can't think about going and getting my mental health treatment when I'm worried about finding shelter for the night. Many of these individuals don't know how to even access the treatment that they need, whether it's a physical health care, whether it's a mental health care, whether it's substance use care. What's the transportation plan for getting there? How do you schedule an appointment? I think about how challenging it is for me to navigate my own health care. And then I think about how would I be navigating my own health care if I didn't have a phone, if I didn't have an address, if I didn't have access to a computer, if I didn't have some knowledge about how the system works. And so the reality is, I think we really have to think about individuals as humans first, and think about how do we set up the infrastructure in a way that helps each of us as humans have a path of hope. So with that, moving on to the next question. Okay, Kate, would you share with us your perspective of how healthcare providers and homeless services organizations can work together to better address the complex health needs of individuals without homes? Are there successful models or initiatives that you can highlight?
Yeah, I'd be happy to. So for the Central California Alliance for Health, we are the local Medi-Cal health plan here in Monterey County. We're also in Santa Cruz and Merced County, and expanding to San Benito and Mariposa County in 2024. And so first and foremost, I think it's the recognition that housing is health. That's a huge shift for the Medi-Cal providers, and with CalAIM, the California Advancing and Innovating Medi-Cal waiver program, the Alliance has had the opportunity to have a seat at the table to really, partner with so many of you in this room to address these issues. And so, secondly, I think what's really important is that we have the opportunity to test, pilot, and support our members with new services. And so a couple ways that we're doing that right now is, as I mentioned, with the HMIS data integration. So making sure that we're funding the HMIS administrator and also receiving that information and digesting it to have a better picture of our members experiencing homelessness. In the past, the Alliance had a very cursory way of identifying members who are homeless, and now we have a much better picture of our members experiencing homelessness, and that helps us to better support them. And then paired with that is the ECM community support program. So enhanced care management is an opportunity for care managers to meet members where they are, no matter where they are, and to provide more comprehensive support to members with complex health needs. And then the community supports program, there's a housing suite of what are considered in lieu of services. So they're services that are really meant to provide support with social services. And so there's housing navigation, the housing deposit. So Tiana, what you were talking about in terms of, the individual with the quote saying, well, I need that first and last month's rent. The housing deposit provides that. So Medi-Cal now, our managed care plan is able to reimburse for last month's rent, the housing deposit, and there's also support for utilities, so first month of utilities as well. There's housing transition navigation services and housing tenancy and sustaining services, so making sure that once I am housed, I can remain housed and have support talking to my landlord and those sort of things. And then there's also new community supports that the Alliance has been involved with now for almost 2 years, which are recuperative care. So being able to reimburse the stay for an individual when they're discharged from an inpatient setting and have a place to stay for at least 90 days or up to 90 days where they're receiving daily support, meals, and housing navigation. And then relatedly is the bridge housing. So under CalAIM, that short-term post-hospitalization housing. And I'm looking at you all because many of you are our partners and our providers of these services. And so Medi-Cal has really had this great opportunity, the managed care plans, to get involved and to partner. And we're just excited to learn from the service providers and to continue partnering.
Thank you so much. And I'm going to jump in here real fast, and then I'm going to go to you, Rebecca, if I could. You mentioned bridge housing, so as behavioral health, that's one of the things that we are actively working on right now. And so we got a grant from the state that is allowing us to work with the housing authority to convert an apartment complex that exists in Marina to be a bridge housing site. It's a 55 unit, two bedroom unit apartment complex. We're setting it up to be a shared housing environment. Again, looking at how do we wrap services around individuals. We'll be RFPing for a provider to operate and help people start navigating towards a permanency housing solution for themselves from day one of going in there. I know as Monterey County Behavioral Health, I know that right now we have over 300 individuals we're currently serving who are identified as homeless. That is just specifically for Monterey County Behavioral Health. So I'm looking at this as a place that there's 110 people prospectively at any given point in time that hopefully we can help navigate and find stability. This is going to be a 4-year program. I'm very excited about it. I also know that we're going to have to find resources to sustain this beyond 4 years, and that it's a starting point to meet the need. As I indicated, I know just on my behavioral health electronic healthcare records, that I have 300 people already that need this level of care, that needs this support, and I'm going to be able to serve about a third of them. And that doesn't count to everybody else. So this is a start. It is not an end, but I definitely wanted to share that, and it's something that we're very excited about. The other thing, just from the behavioral health standpoint, really looking at housing affordability as a key issue. I do know that talking with our housing authority, one of the really big concerns that we have as a community that she has shared with me is that while we have unutilized Section 8 vouchers, or that people have an opportunity to have subsidized housing, but they can't find a place, they can't find a landlord that is willing to take them. And so we have, I believe, and don't quote me on this one, but I believe that there was over 100 unleased vouchers this past year because we don't have sufficient housing stock affordable enough to have someone with a guaranteed income to pay for it. We don't have that available. And so that's a challenge that we need to face as a community. And so with that, I do want to turn this over to Rebecca and hear your thoughts and your words.
Yeah, absolutely. So building off of what Kate said, I'm from Anthem. We are a Medi-Cal provider in San Benito. And we've also been very busy standing up these CalAIM services the last 2 years. Managed care plans, we historically have not been experts in homeless service. We have not been part of the housing space, which was why it was really important for us to, invest internally in a housing-focused team. So, I'm recent to Anthem, but my experience over the last decade has been working for homeless service providers and really working to bring that, knowledge, that specific language, that experience of, the challenges that both service providers and clients experiencing homelessness have into the implementation and the investment strategies around CalAIM. It's really critical for us that we integrate this in a way that it is augmenting the amazing work that our service providers in the community are doing, instead of being duplicative. So to provide maybe an example, Sacramento County had 75 vouchers that were earmarked for transitional age youth experiencing homelessness, and the COC released an RFP for providers to do supportive services, and there wasn't any responses to the RFP. But in working with the COC, we said, hey, that's a population of focus for enhanced care management, and we're pretty confident that all those voucher recipients are going to be eligible to receive supportive services through the managed care plans. So it's that kind of creativity and collaboration and strong partnerships that are going to make these services really impactful.
Thank you so much. And Tiana, is there anything that you would like to add to the conversation here? Thank you so much. Okay, so moving on. Let's start with Tiana on this one then. In your experience, what are some of the key barriers to accessing healthcare services for people experiencing homelessness, and what steps can be taken to overcome these barriers?
That's a fantastic question. We talked with our participants in depth about this. And I think one quote particularly sticks with me. One participant talked about how being homeless is a full-time job. You're constantly thinking about your safety, where your next meal is coming from, and making sure that you have adequate shelter, thinking about the weather conditions. There's so many things that are going on in your life that make it also difficult for you to prioritize your health and accessing healthcare. I think some of the barriers that emerged and kind of the in-depth interviews that we conducted and in the survey data were logistical barriers. So thinking about transportation, thinking about the fact that people are often moving, given kind of forced displacements that happen within the community. And then you kind of lose this connection with the services that you were previously accessing if you were, because of that kind of logistical barrier that has been kind of thrown your way. Also, I think given the high level of kind of mobility impairments that we have in our population, that's also a kind of another additional barrier that people face when trying to access healthcare services. When we talked to our unsheltered participants, many talked about not kind of seeking services that required them to leave because they were worried about their belongings. They had no door to lock at the end of the day, and the belongings that they had to really kind of support their survival outside, they needed to do everything they could to cling on to them, which meant it made it very difficult for them to kind of think about leaving where they are to access those services. And so, I think to your second question about what can we do to overcome those barriers, we need to meet people where they are. Street medicine is a very crucial tool to actually make sure that we're serving people where they are, that doesn't require them to kind of navigate these really difficult logistical barriers, difficult transportation barriers, but really provides care at the place where they are at. And I think another perhaps less discussed kind of barrier, at least amongst us, but definitely discussed amongst our participants, is discrimination. Many folks talked about how their perceived housing or homelessness status really made it difficult for them to access services in the same way as other people, be treated with the same level of dignity and respect in those healthcare settings. Many of our participants of color, especially, express hesitance in accessing those healthcare services because of kind of the other access of like identity-based discrimination that they have to contend with. And so, in thinking about overcoming those barriers, I would definitely suggest us thinking about what we can do for our healthcare workforce to increase training, increase cultural competency, making sure that we have a healthcare system that treats folks equitably, no matter their housing or homelessness status.
Thank you so much, Tiana. I'm going to add on to that as well from the behavioral health perspective. When we think about how far we've come as a society to overcome stigma on mental health and how far we still have to go, right? Let's think about the stigma that is attached to being homeless. It's even more pervasive than stigma being attached to mental health or substance use conditions. People look at someone as homeless as a problem, not as a human being. And we have an obligation to figure out what can we do to, again, provide that respect, interact with people on a human-centric level, for everything that we do. Contact individuals as human beings. Don't, when people walk by and they make no eye contact or they cross a street or, they're not treating someone as a human being. And so then I hear, as a behavioral health director, I hear about how this person is acting up and is clearly a behavioral health problem in the community because they're acting up in whichever way. Imagine for yourself, thinking again about yourself or your family, how do you react to being put down? How do you react to someone treating you as less than? And then think about, here's someone who doesn't have a lot of hope right now in their life, someone who is being actively disrespected on a daily basis. What do you have to lose by acting out? And if you're feeling frustrated, what do you do? So again, I just really want us to think about that human-centric piece and about human dignity and respect and what we can do to remove stigma attached to homelessness. And so with that on my soapbox, I'm going to ask Kate, is there anything that you would like to add?
Yeah, so I think one pilot that I'm really excited about at the Alliance is our street medicine pilot that we have offered now for about a year. We've partnered with at least one provider in each of the counties that we serve, and in Monterey County, it's CSVS, Clínica de Salud del Valle de Salinas. And we have used dollars that the Alliance has earned through the DHCS, Department of Healthcare Services, Housing and Homelessness Incentive Program, to fund CSVS to expand their street medicine services. And they partner with Dorothy's Place, who provides the street outreach component of that. And so recently, the federal CMS, Centers for Medi-Cal and Medicaid Services, has actually gone live this month with a new place of service code for street medicine. So for us in managed care, that's really exciting. For you all, that's like boring information. But what that means is that managed care plans can begin more formally reimbursing for street medicine services. So the Alliance is currently working to figure out how to create an official formal street medicine benefit through the Alliance, and where we would expand our partnerships beyond just the one provider in Monterey County.
Thank you so much. And Rebecca.
So similarly, Anthem has made significant investments in street medicine, and we're really excited because this is a really innovative approach. To add to that, in thinking about connecting folks to health services, we're also working really closely with the COCs and their HMIS systems to make sure that we're including that health plan information on that member profile, so we can quickly get folks connected to those CalAIM services that they might benefit from, and get them connected to their healthcare provider. I know in some of our communities, Santa Clara County comes to mind. We're also looking at integrating healthcare data into the vulnerability assessment. So we know in a lot of communities, we're kind of looking at that tool and how we're prioritizing housing resources and wondering if it's effective, and making sure we're kind of bringing in that lens of, you know, a healthcare and a person's vulnerability as it relates to health.
Thank you so much. Okay, so moving on. Homelessness and health are undeniably linked. Can you share examples of innovative strategies or programs that have effectively improved the health outcomes of homeless individuals while also addressing their housing needs? Rebecca, can I start with you?
Makes sense because I'm holding the mic. So we're at the forefront of this, and we're really excited to see some of these CalAIM programs and the impact that they have. But in anticipation of CalAIM, Anthem did do some housing pilots in 8 of the communities that we work in. And as part of those pilots, we did a cost of care and a health outcome analysis. And we found, you know, improvements across the board, both in cost of care as well as health outcomes for the member. And some interesting information that we also learned from that is those outcomes were more impacted when we partnered with a service provider that was based in the community, that had a knowledge of the landscape and the population that it was serving. So we took that into our approach with implementing CalAIM and making sure that we're really identifying those kind of key housing service providers in those communities to deliver those services.
Thank you. Tiana.
Thank you. I do want to echo Rebecca's statement about CalAIM. There's a lot of promise in the program, and when we look at the data across all of our participants, 83% of our folks are covered by some form of health insurance, and this is primarily through Medi-Cal. And so what I think is important is that CalAIM represents this really great partnership between the federal and the state level. And what we need to do is kind of think about how to support implementation of CalAIM on the ground so that it can be as robust and successful as possible. But I will say, in general, any program that really prioritizes getting folks housed without precondition, kind of on a housing first basis, will ultimately improve health. Housing is the core of stability, is the core of someone's health, and being able to make sure that they have that kind of safety and security and stability is incredibly crucial for someone to think about healing from the traumas of experiencing homelessness, life course traumas, and also be able to attend to their physical and behavioral health needs. One of my good colleagues at UCSF BHHI, who is the director of the center, always says that housing is the most powerful medicine that we can provide. And so when we center that in any program without any kind of precondition to accessing that, we are ultimately going to be centering someone's health and well-being.
Thank you. Kate?
Yeah, so I mentioned the HHIP, the Housing and Homelessness Incentive Program. So for the Alliance, recently, so first of all, in Monterey County, we have the opportunity to earn $21 million. The Alliance has to earn those dollars, and then we can spend them in the community to provide, basically, we worked off of the HAP, the Genevieve, where are you? Roxanne, the Housing and Homelessness Assistance Program. There we go. And their list of needs in the community, and also the funding, the list of funds that were provided, and we identified needs together with the COC. And from the start, it was housing, right? Yes, we could use more recuperative care beds. Yes, we could use street outreach. Yes, we need street medicine. But at the end of the day, we need more permanent supportive housing units. Since 2017, the Alliance piloted a recuperative care and bridge housing pilot prior to CalAIM. And in terms of the benefits to our members, what we saw was in every county that we worked in, there was an issue with members getting stuck, where the length of stay for the recuperative care stay and then the bridge housing stay, right? So recuperative care was up to 90 days, bridge housing was up to 3 months. Now with community supports, it's up to 6 months. Still, folks weren't getting housed because there wasn't a unit for them to discharge to. And so what the Alliance is doing now is we're exploring a permanent supportive housing fund. So we're working towards earning that final about $12 million from DHCS for HHIP. We're hoping to earn those dollars by March, and we're exploring opportunities to invest those dollars in the community. And we're really looking towards something that's more sustainable than just a one-time grant, but creating maybe an investment fund that would support those initial construction costs, for example. So we're in the early stages of identifying our potential opportunities. We are working towards earning that last $12 million. And we're really excited to hopefully see improvements in Monterey County.
Thank you so much. And I also want to share that we as behavioral health here in Monterey County, we see the need for the whole continuum of treatment beds, and then moving on to permanent housing. We work with different partners, interim housing being one of them, to provide supportive services for some permanent supported housing. The issue being, of course, there's not sufficient beds, there's not sufficient permanent units, and again, wrapping the supports around is typically a Medi-Cal benefit, and we are reimbursing it as a Medi-Cal benefit, and that works out well. Where we run into problems is, again, on having sufficient permanent housing, and then also we struggle with having sufficient treatment beds available. There's many times if someone needs a locked level of care, we have to send them outside of county. Well, you send them outside of county, it's much harder to keep an individual connected with their natural supports in their community, their friends, their family. And, that disproportionately affects our lower income, typically communities of color, and then reduces the resources and that connection and those supports to help an individual on their path towards recovery. So one of the things that we're doing on that, we got a grant award from the state to convert a facility that's on basically the Natividad campus. We're going to convert it into a mental health rehabilitation center. And there's a lot of work still to be done to get it done, but it will be a locked level of care that will hopefully be able to foster some of those community connections, those natural supports around an individual in a home county anyhow, and then hopefully be able to help them step down to a lower level of care where it's supported, and then from that level of care maybe step down to a transitional level of care where we're seeking permanent supported housing on the long-term basis. And so again, the place that we have our complicating factor is that we need housing for long-term, and then we need to be able to build the supports, and also knowing that we need sufficient workforce to be able to build the supports that individuals need around them where they're at is a really key issue. So last question, and I will start with Tiana. As we emphasize the connection between housing and health, what are the broader implications for policy and resource allocation in addressing homelessness and health care? How can we create a more integrated approach to ensure that a lack of housing is not a barrier to health?
That's a fantastic question. You know, I think one of the things that I want to put out into the world is that we need to make simultaneous investments in permanent housing, some of which should be permanent supportive housing. But simultaneously, we have to think about ways to conduct outreach to folks who are currently suffering. You know, as much as we would like to see everyone housed tomorrow, that's not the reality given the current kind of structural conditions in the state of California. And so we need to think about simultaneously investing in kind of these permanent housing resources, but also invest in sustained outreach to folks who are just feeling abandoned right now, who are feeling like they're not getting the resources that they should in order to kind of support their return to housing. And so anything that we can do that simultaneously, you know, shows that, you know, the priority is permanent housing and the goal is ultimately to get people into permanent housing, but also doesn't downplay the fact that we have a significant number of folks who are outside, particularly unsheltered, that need support right now.
And Kate.
Yeah, so, you know, I think it comes down to braiding funding. And to Tiana's point, so at the Alliance, we completely agree. There's you know, the long-term need of having those permanent supportive or, you know, affordable housing units. And there's some urgent needs. So with the HHIP dollars that the Alliance has earned thus far in Monterey County, we've earned just around $10 million, and we've spent or allocated at least 5 already towards I think over 5 street outreach providers across the county. We have our street medicine pilot. We're funding the coordinated entry system assessment program, looking at that VI SPDAT and identifying where health questions can be added. And so it's really about, in addition to that sort of immediate need, looking at in the long term, how can the Alliance as a partner help to unlock dollars in the community? So, you know, one thing that we have tracked is that when the Alliance is able to provide the COC with funds for street outreach, for example, then that allows them to utilize, to retain those funds that they normally would have spent on street outreach and put it in a different area, which then also might unlock additional funds and or additional vouchers. And so we're tracking that, and we're trying to work creatively with the COCs in each county that we work in to identify, you know, it is not lost on us that $21 million is not just a drop in the bucket. And And so we're trying to work creatively to come up with sustainable solutions, and we're really looking to you all and excited to continue to partner to come up with creative solutions to make sure that these dollars can make a lasting impact.
Thank you. Rebecca.
So just adding to what Kate and Tiana said, well, I'll add to what Kate said. That's a lot of money. And so we haven't, again, I want to reiterate, we haven't thought of the managed care plans as funders of homeless services, but here we are. So kind of looking forward into the future, I, would really encourage the providers, the cities, the counties to get to know your plans, to create those relationships with your managed care plans, to provide feedback, if you are working with CalAIM programs, on how those programs are being implemented, what your challenges are, what the barriers are, because we really want to see these initiatives be successful, and we really want to take and integrate that feedback. Kind of talking about policy and looking forward into the future, something I'd like to share with this group is, we recently got wind from DHCS that in 2024, we might be looking at the managed care plans having rent be an allowable service. So 6 months of transitional rent. Again, I want to reiterate, this is new, this is exciting. This is something that, we in this space didn't anticipate being an allowable expense. So again, really encouraging folks to start to form those relationships because again, we really want to partner to be impactful, to make sure we're identifying gaps, as Kate mentioned, so that you are able to braid funding and utilize existing funding in new ways.
And to wrap that up, I absolutely agree with all of my colleagues up here. And then one of the other things, besides the whole idea of coming together, and we have to be strategic and we have to partner together, we have to be smart about how do we leverage finances together to have sustainable programming to meet the needs of our community in hopefully innovative ways. One of the other pieces that we need to figure out is how can we better share information to, first of all, figure out the holistic needs of an individual, and then be able to wrap the needed services around that individual, and then capture that data on a macro basis so we know what is effective in what we do and what is not effective and what needs more attention. Without data, we don't really have a good way of measuring the outcomes and measuring whether we're making a difference or not. And so my hope is that, we manage to get through, the federal rules, the state rules, the local rules in all the different areas to be able to come up with a path that lets us do that in order to benefit a client, in order to benefit a human being. And so thank you all. And if you have any questions for us, that was the last of our organized questions up here for the panel. Anyone, any questions? Did we answer it all? Yeah. Well, yes. And so it just really depends. So what service is it that we're trying to access? And yes, right now our system is very fragmented. And so do you access it by going to social services? Do you access it by going to Social Security? Do you access it by coming to behavioral health? Do you access it by reporting in the hospital emergency department? Do you access it by calling your health insurance? Where do you access it? And that's one of the coordination pieces. CalAIM has an idea of no wrong door. But in order to truly have an effective no wrong door, there has to be an effective referral and sharing of information process to be able to help people have that seamless navigation. There's no, I wish that there was one. And so that is, again, one of those pieces that remains to be created in our system. Yes. Yes.
So I can speak for Anthem, and we are a managed care plan in San Benito, but kind of in that spirit of the no wrong door. You are able to access, if you're a provider, even if you're not a contracted provider, the ECM referral form. But one of the easiest things, so anybody that's experiencing homelessness is eligible for the CS housing services and ECM, is to have them call their Medi-Cal customer service line and have them request to get connected to ECM. Again, that's specific for Anthem. And right now we are just in San Benito, and we'll actually be transitioning out at the end of the year, which, we're sad to go. But we are seeing more plans kind of, each plan is going to have their different process. But if you're not sure what that process is, I would start with the Medi-Cal customer service line.
Yes.
And just shout out to Jessica Hampton, our manager of ECM and community support services at the Central California Alliance for Health.
Thank you. Thank you so much. And I think with that, we are at over time. So thank you so much for listening to all of us and our thoughts.
So nice to meet you.
Let's give another round of applause for that amazing conversation we just had, everybody. Don't we have just incredible speakers today? So we are getting ready for our closing down ceremony. We're going to get started in about 7 minutes. So put your stopwatches on. It's happening. It's in this room. We're going to get all the other rooms closed down. And we're excited to see you guys back here in about 7 minutes. Thank you, everyone. Testing. 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 All right, we're going to get started soon for closing ceremony. If you can all start trickling in. All right, everybody. We are getting close to the end here. If you can find your seats and get comfy and cozy, we'll get started. All right, everyone. Ladies and gentlemen, and esteemed guests, leaders in the fight against homelessness. As we draw near the conclusion of the pivotal summit on homelessness, focused on regional solutions in Monterey and San Benito County, I'm truly humbled and inspired by the collective commitment and unwavering dedication of everyone in this room. We have come together to address one of the most pressing humanitarian issues in our local communities. Homelessness is not just a problem, it is a crisis that touches every corner of our region. It's an issue that affects not only those without a place to call home, but the very fabric of our societies and our collective humanity within these counties. Throughout this day, we've engaged in insightful discussions and fruitful exchanges spanning the entire spectrum of homelessness, from systems change to conversations with those with lived experience. Our intentions were to collaborate, to open our hearts and minds, and to find local solutions to homelessness that are not just aspirational, but actionable within Monterey and San Benito County. I'm deeply moved by the stories and experiences shared by those who have faced homelessness firsthand in our region. Your courage and resilience have been a guiding light for our discussions, reminding us that every statistic is a human being, deserving of dignity and respect. It is your voices and your strength that drive our determination to create real change right here at home. The presence of local leaders in homelessness at the summit highlights the importance of a unified regional effort. Homelessness knows no boundaries, and neither should our solutions. By bringing together leaders from within Monterey and San Benito County, we have laid the groundwork for a shared commitment to eradicating homelessness in our immediate communities. At this time, the Coalition of Homeless Services Providers and the Lead Me Home Summit Committee would like to recognize 3 individuals and leaders in our counties for their unwavering support in ending homelessness in Monterey and San Benito County. If I can have the awardees coming up. The first award that we will be awarding is Timothy Heaven, who will be receiving Timothy is receiving the Dred McCall Community Hero Award. Picture time, paparazzi time for Timothy. Timothy, any words to the community?
I didn't really come prepared for this. Yeah, I mean, it's so great to see all these people here. Each and every one of you can make your own impact in your own way, and I'm just really happy to have such great people I work with, a great support team, and to just notice that my work is not being unnoticed. It's really good. I've never received anything like this, so it's just really, I'm really excited to have some appreciation and know that my work's not being unnoticed. Thank you.
Thank you, Timothy. The second award is our Attorney Legacy Award that is awarded to Clifford Andrews from Community Health Engagement. All right, Clifford, the microphone is yours.
Yeah, I would like to thank all the outreach teams out there. So this award is for all the outreach teams in the county, especially my Che Core team. And then my boss, Jackie Smith, who I've been with for 3.5, 4 years. And she doesn't, breathe down my neck when I'm trying to get the job done, or the outreach team in general. So I appreciate the outreach teams going through riverbeds, going through levees, hills, going down alleyways, and I'm nervous. Whew. Okay. And I'd like to thank my mom too, because she created a badass. So.
And for our Beyond Government Award that will be accepted by Mayor Mike Labar, Steve Adams, who couldn't make it with us today, but we still should cheer him on. So please, let's welcome up Mayor Labar. Mayor Labar.
Steve really wanted to be here today. And if any of you know our city manager, Steve Adams, he's an extremely humble person. He appreciates the award, but he wanted to make sure I thanked all of you who do this work every day, because you're the ones who deserve the recognition. That is the type of person Steve is. He puts his heart and soul into our project. He is a compassionate individual. And I will tell you, he has put so much time in to solving our homeless issue within our community. But he hates to be recognized. And I'll make sure I let him know that his work is very much appreciative. He loves all of you that are doing God's work. And he loves all of you for what you do to help our fellow humans. Thank you.
Please help me give a round of applause to these incredible community heroes, everybody. There's not enough words to say how much impact these three folks have made in our community. There's so many more that are unnamed, and you are recognized, you're seen. Thank you for all the impact that you've done. And big shout out to our services directors. You guys do the hard work every day to make sure our people feel seen, heard, and loved. And thank you. As we close up our ceremony, I just wanted to do a little round of acknowledgements. First, to CSUMB that allowed us to have this beautiful space to convene together. Thank you, CSUMB. Let's give a round of applause to them. We have Vitsula Visuals, who were just the IT AV magic of today. Let's give them a round of applause. Our lovely caterers, Dorothy's Place and CHSP member, you were incredible. That food was incredibly tasty. We want to give a thank you to our sponsors, the County of Monterey, who not only was a sponsor, but just an incredible help for running this event and supporting us and setting up like tablecloths, orchids, all the things. Just thank you for beyond sponsorship. Really, really appreciate the time that you have given. So let's just give a round of applause to them. We have our additional sponsors. We're just incredibly humbled by the amount of sponsorships that we've received to be able to make this event happen. So I'd love to list out the rest of our sponsors. We have Montage Health, Community Foundation of Monterey, Union Pacific, Natividad, Anthem Blue Cross, Central Coast Alliance for Help, Pinnacles Bank, Comcast, and Community Human Services. Let's give a round of applause to them. I want to give a special shout out to the coalition staff. I mean, holy bananas, yesterday was wild, and look how beautiful it is. So just to give a round of applause to the coalition staff, you all are incredible. We had our summit committee. So we, as we say here, we make everything for the community. We create with our community. So we had a committee that was in charge of really helping us navigate which conversations to have, who to bring, everything in here from orchids to linens. We had discussions. So thank you to our summit committee. Really appreciate you all. And another thank you to our coalition board of directors, as well as our Continuum of Care Leadership Council members. Thank you for endless leadership in making sure that those that are affected by homelessness are heard and seen every day, and making sure that we make the best decisions for them at the ground level, at the level that we are at. So thank you so much for your leadership. As we prepare to leave the summit, let us not forget the collective strength we have harnessed today. We have set in motion a wave of change, and it is up to us, to each of us, to ride that wave forward with Monterey and San Benito County. Let us go forth with a renewed sense of purpose, armed with the knowledge and connections and the commitment to make a difference in our local communities. As some of you know, my last day is going to be tomorrow with the coalition, but I just wanted to let you all know of the incredible hands that I will be leaving this amazing organization in, which is Katrina McKenzie, who will be the interim executive director. I feel like she's hiding right now, but wherever you are, aha! Let's give a round of applause to our new leader, Katrina McKenzie. Wave to the crowd. I just want to say it's been an honor to hold this position. It's been an honor to accomplish and hit the milestones that I have been able to with the team that I have. You guys are incredible. And just thank you everybody for showing up today, for asking questions, for being active listeners, and for wanting to be a part of the solutions. Thank you, everyone. That's our event. A last message, if you really enjoy our orchids and you want to take one home, please do. We won't say no. Definitely take an orchid home. I'm sure someone will love it.